order the Planning Commission meeting of December 16, 2015. And with this, Mr. Blackwell, will you lead us in the Pledge of Allegiance? All rise, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. City Planner, would you please call the roll?
Commissioner Eggleston.
Here.
Commissioner Blackwell.
Here.
Commissioner Ruland.
Here.
Chair Brown.
Here.
Commissioner Crandall.
Here.
Commissioner Wu.
Here.
Commissioner Smith.
Here.
There are no special orders of business tonight. We do have the minutes from the Planning Commission meeting of December 2nd to approve, and if there are no comments or changes, I'll entertain a motion.
If there are no comments, I will so move that they're approved.
Do I have a second?
Second.
I have a motion and a second to approve the minutes of December 2nd. All in favor? Aye. Opposed? Passes 7-0. Oral and written communication. Members of the audience may address the Commission on matters of public interest which pertain to the city and are not otherwise on an agenda. If you wish to speak, please step forward to the microphone and state your name and city of residence and make your presentation. Please limit your presentations to 3 minutes. Madam Secretary, do we have any cards as far as oral written communication?
No, Chair.
Okay, thank you. We do have an item on our consent calendar tonight, no parking restrictions adjacent to driveways on public streets. It is on consent. Is there a motion to approve?
I'll make a motion that we concur with staff's recommendations.
Do I have a second?
Second.
I have a motion and a second to concur on the parking restrictions consent calendar. All in favor?
Aye.
Opposed? Passes 7-0. We're now going to public hearings. All items on the public hearings time limitation for applicants is 10 minutes. All of the speakers are 3 minutes. And we do have a special 10-minute presentation tonight. To facilitate the meeting and attendance of the public, please enter your card. I'll try to call the cards during public testimony in order and get people in order so that we move quickly through the process and so we can get on with the deliberations. With that, we'll entertain the zoning amendment 15-456 medical marijuana ordinance. Mr. Petches.
Mr. Chair, members of the Planning Commission, this is a request to forward a recommendation to the City Council for the adoption of an ordinance that would prohibit marijuana cultivation, manufacturing, testing, delivery, and dispensaries in all zoning districts throughout the city, including the specific plan areas. The medical marijuana regulations are in the Safety Medical Marijuana Regulation and Safety Act recognizes the local jurisdiction's ability to regulate these types of uses, with the one caveat, which is that the city has till March 1st in order to complete an ordinance with the city's regulations. After that point in time, state regulations prevail, and there's no other opportunity for the city to regulate these uses. For that reason, the City Council has directed us to move forward with this particular ordinance. Also, I'd like to note that Todd Leishman from BBK, who has assisted the city in drafting the ordinance, is available to help answer any questions you might have. And that concludes our staff presentation.
Does the Commission have any questions of staff or Mr. Leishman from BBK?
I have one question.
Of the staff or our...
Oh, I'm sorry, of legal.
Okay.
Are you aware of any appeals made to the Court of Appeals or Supreme Court on the recent legislation?
Do you want me to answer this or you?
Mr. Chair, Commissioners, I'll answer that question. The only litigation that's at play when it comes to marijuana dispensaries is the Supreme Court case from about 2 years ago, which was actually litigated by our office, which contains the current law with regard to medical marijuana regulation at the local level, which permits us to do exactly what is being proposed this evening. To our knowledge, there's nothing currently on the docket, and this is the current law. It's fairly straightforward.
Mr. Eggleston?
If the
If the citizens of the state of California put forth an initiative on the ballot, how would that affect us?
Mr. Chair, Commissioners, that would change the legal lay of the land. Currently, the MMRSA is the law. We currently have the ability, pursuant to Supreme Court precedent, to regulate dispensaries, cultivation, transportation, et cetera. If the voters decide to change that, then that would change what we are allowed to do. As of now, that hasn't happened, but there certainly are rumblings of ballot measures that will be on the ballot November 16, and we'll see what happens then. But currently, we can regulate it.
Thank you.
Mr. City Planner, I have a question for you also that we discussed earlier.
I was going to, add that. Just a note to the Planning Commission, another agenda item on tonight's meeting contemplates adding a new zone to the city, and currently this particular ordinance doesn't include that zone in the list of zones, so we would just ask that you direct us to add that, assuming that and or if it was approved in the later item. So
subject to approval, if we do approve, then we would add CC4 to the resolution. Thank you. So there are no other, Mr. Wu, you have a...
Yes, Mr. Petras. There are two resolutions tonight. The second resolution lists 3 specific plans, including Rancho San Clemente, Talega, and the West Pico corridor. There are other specific plans area in the city, and they're not included in those resolutions. And we want to make sure the language is tight to cover every piece of land in the city. So where are other specific plan areas, such as the Marblehead, Peerbo, Foster Ridge, etc.?
The specific plans that were targeted specifically had areas that were commercial and business park land uses, and that's why they're included. All the specific plans have language that defer to the zoning ordinance when use is not mentioned. So we felt that the existing regulations within the specific plans cover the residential areas.
Okay. Thank you.
Okay. Good question. Any other questions of staff or legal? With that, we'll open up the public hearing. And we have 3 cards tonight. The first one is Susan Parmalee, followed by Kimberly Hernandez, and then followed by Marcy Vanicki.
Hi, Planning Commissioners and City staff. Thank you for giving us some time to speak tonight. I'm going to be really brief. I represent the Wellness and Prevention Coalition here in town. We are a coalition that represent 12 sectors through our city. We've recently received funding from the federal government to maintain a drug-free community in San Clemente, and one of the main strategies we use is to promote environmental change, and we really want to commend city staff for how they wrote this ordinance, because it's a true example of environmental change. In addition, I sit on San Clemente High School campus as an independent therapist under our program, working with children who've been diverted to me because of substance abuse infractions on campus. And if anyone tells you we do not have a marijuana problem in this town, it's not true. We have a youth marijuana use problem in this town, and we need to do everything we can to keep marijuana out of the hands of kids. I brought some handouts today, and I also brought a student, Kimberly, who would like to say a few words as well. I don't know if you want to restart the clock. We're not going to take 2 minutes.
Good evening. Good evening, I'm Kimberly, and as a young adult in San Clemente, I hope that more kids have the opportunity to live in a drug-free environment. I want to thank the city staff for recommending that we limit the access to medical marijuana sales, because I don't want to live in a town where marijuana is easily accessible. And also, I live in a part of town where almost a lot of people sell drugs and they sell marijuana, and I don't like the smell, my parents don't like the smell, and I wouldn't want my little brothers getting into that stuff, because I see that they have a bright future ahead of them, and I wouldn't want them getting involved with something that would prevent them from doing what it is they want to achieve in life. And I wouldn't want my friends getting pressured into doing it, because some of them already have, and I've seen it take its toll on them, and they have just been forgetting about school and just going straight into the drugs. And it's just preventing them from doing what I know they can do in life. Thank you.
Thank you for coming tonight. And then Marcy Mednick from Mission Hospital, I guess?
Yes, thank you. My name is Marcy Mednick, and I'm here representing Mission Hospital. And I wish to speak in support of your zoning amendment, 15456. And because Mission Hospital has done a community needs assessment, as well as the California Healthy Kids Survey, and because of the data from those surveys, we have a strategic initiative to reduce substance abuse in South County, and particularly in San Clemente. So we wholeheartedly support your zoning amendment, and thank you for doing that.
Thank you very much for coming tonight, Susan. Are there any other cards, anyone that wishes to speak on this item? With that, I'll close the public hearing, and we'll open commission discussion or a motion.
If there's no discussion, I'd like to move the motion.
I would like to say one thing. This is there's a lot of good things in this zoning amendment, and there's nothing specifically. There's no. I should say there's no one item that I object to in it. In fact, I like the local control. I like preventing the growing of it. But long story short, I had a loved one pass away from cancer after a couple of rounds of real tough chemotherapy, and we don't. This is a total ban. We don't have even a narrow path for someone to take advantage of perhaps some route to alleviate that suffering. So while I like basically everything individually that's in here, I'm not going to be able to support it for that personal reason.
Okay.
I have a comment. I'd just like to say, reading through staff's report, which is thorough, one thing I did not see, and I wouldn't expect it considering the intent here, but would be a sort of a start to how we would regulate should the use become legal at a higher level, and we get faced with dealing with that. So I would like to see staff sort of thinking in those terms and just sort of be prepared so that when the time does, if it does come, that we are ready to address it effectively by way of ordinance revisions, updates, amendments in every zone.
Okay, thank you. Kind of tough to predict the future. With any other discussion?
The only discussion I have, Jim, is that if they have a medical marijuana card, they're able to cultivate it, are they not, for their own use? So
My understanding is with this ordinance, they're not able to cultivate it for their own use. Is that incorrect?
That's my understanding, but Todd, is there any exemption for individual use in this? I think it's prohibited throughout.
Yeah, it is. There is no exception in here.
Is correct.
Yeah, I read it as no exceptions.
I direct your... My time's up. I direct your attention to the definition of cultivation. I don't recall there being an exception for even a small number of plants. That said, if you have a medicinal marijuana card, you can go to another jurisdiction where you can buy it. So
Okay.
there are some narrow options.
okay.
In other words, you can drive to San Juan and if it's authorized there with a
Wherever
card
they-
or whatever.
Authorized. I'm not going to point a finger
Okay,
at San
thank
Juan,
you.
but
Some other location, thank you, I'm sorry. Appreciate that. Okay, any other, okay, with any other discussion, Commissioner Eggleston?
Yes, I'd like to move a resolution of the Planning Commission of the City of San Clemente, California, recommending that the City Council approve zoning amendment 15-456, amending Title 17 of the San Clemente Municipal Code, and approving specific plan amendment 15-471, amending the Rancho San Clemente specific plan, Talega specific plan, and West Pico corridor specific plan to prohibit cannabis cultivation, cannabis manufacturing, cannabis testing, laboratories, cannabis delivery, and cannabis dispensaries.
With the addition of...
With the addition subject to the approval of CC4.
Is that
RMF one.
Yeah.
All right, thank you. Okay.
I'd like to second that.
Okay, we have a motion and a second to approve. All in favor? Aye. Opposed?
No.
One opposition, so it passes 6-1. Okay. With that, we will go to Item 8B, General Plan Amendment 15427, Zoning Amendment 15428, Specific Plan Amendment 15449 through 452, Camino de los Mares Medical Zones. Mr. Tamian.
Thank you, Chair Brown. Good evening, Planning Commissioners. My name is Adam Tamian. I'm the case manager for a general plan amendment, zoning amendment, and multiple specific plan amendments aimed at encouraging and incentivizing a medical-focused area along Camino de los Mares. Recently, the City Council directed staff to look at ways to incentivize and encourage the maintenance of the hospital site. Staff took a look at this area and reading through the general plan identified multiple things that we could do to encourage the maintenance of the hospital site, specifically dealing with the area in red. This is included the area in blue. This whole area right now is part of the Camino de los Mares focus area, which the general plan identifies as a hub for medical-related uses. The blue area is currently zoned as Regional Commercial 2, and being the hospital site and the congregate care facility, the only things that are really allowed there right now are hospitals and congregate care, and then some medical office. The rest of the red area is identified right now as Community Commercial 2, which just allows a broad range of commercial uses. What staff is looking at doing is, and what we're proposing tonight, is to rezone that entire area with a new community commercial zone called Community Commercial 4, which is very similar to Community Commercial 2 with some additional benefits for medical-related uses, one of which is group counseling. I'll get into those definitions a little bit later, but it's a use that it benefits by being located around a hospital. Additionally, the hospital site would be rezoned as regional medical facilities. Functionally, there's not a whole lot of difference between regional medical facilities and regional commercial, except for the fact that congregate care facilities would not be permitted, and medical offices would only be allowed if they're ancillary, or I should say accessory, to a hospital use. So our proposed changes are specifically to create a regional medical facilities zone and to update the general plan to include that land use designation. We have development standards for that use, the use standards as well. The development standards, it should be noted, are similar to the regional commercial. Right now there's only one piece of property that's actually in this zone, but it's a 6.6 acre lot. There is an ability in the future to subdivide it, to create multiple lots within this zone, but as it stands now, you know, it's historically been a hospital, and based on the size of the property and the 4-decade history of it as a hospital, staff feels that on its own it is able to successfully meet the goals of a regional commercial or regional medical facility zone. The Community Commercial 4 zone, as I mentioned, is very similar to the Community Commercial 2, and it's really a hospital serving zone at this point. And then finally, we have some medical uses and definitions that we're going through and updating. This is where the specific plans come in. The specific plans right now allow a very broad range of terms for medical uses, and what we're doing is cleaning those up to create consistency among all the city documents, but also to focus group counseling uses specifically for this these new medical zones. There's probably many more questions that you'll have, and in the interest of time, I would recommend that I end there and allow you to ask specific questions that I can.
A similar question that Commissioner Wu had, and we just discussed this the other day, which is the specific plans that you did include and the reasons why you did not include the Pure Bowl, Marblehead, Inland, Coastal, et cetera, the other specific plans that are not mentioned in the 4 that are involved tonight.
Yes, that's a great question. The reason is that medical offices are not allowed in the Pure Bowl and Marblehead Inland specific plans. The Marblehead Coastal specific plan does allow some medical uses, but the way that it's currently defined cannot be construed as allowing group counseling, and there's no reason to update that plan to change.
So you feel we're on firm grounds with that direction?
Absolutely. The only places that we need to adjust the definitions and the uses are in the Rancho San Clemente, the Talega, and the Forester Ranch specific plan.
One last question, then I'll let the other commissioners come on. I went back and reviewed the 93 general plan, which was a lot more specific about this site, and I guess we loosened it up for the current general plan. Are we going back to almost to that definition of that was defined in the 93 general plan, our previous general plan?
Yes, it's much more consistent with how this property has been identified since the early 90s, which is Regional Commercial 2. The general plan in 2014 changed, and it was going to move this site to more of a community commercial zone. However, the zoning has not actually taken effect for community commercial. Right now, it's still technically zoned as Regional Commercial 2.
Okay, that was a vision, I think, in a future zoning amendment by Mr. Wright, I guess, the phase 3 report.
Yes, it will be done soon. One note about the community commercial: the move to community commercial in the general plan was really an attempt to help the hospital site become more successful, but it was never envisioned as the general plan incentivizing a hospital to go away. You know, it is identified as a critical facility in the general plan. It is also there. You know, a reasonable person could read the general plan and come away with an understanding that the general plan in no way wants to disincentivize a hospital, and it's to the opposite. Everything that's discussed about the Camino de los Mares site, about the hospital site specifically, is about the encouragement of the maintenance of that use, and it's important to this city. You know, that's where this direction came from. This was seen as an overarching public health concern, and that's why you know, we've really looked into better ways of incentivizing the maintenance of this site.
Okay, thank you. Commissioner Smith, you have a question? Michael?
Yeah, I have several. With the advent of what's going on with the hospital now, if we were to approve this zoning change and then have the hospital do what they've been telling us that they might do, remove the emergency room and, I guess, downscale a facility to more of a clinic than a hospital, would this exercise be in vain at that point? I mean, would we have a zone for something that it now isn't?
If they were to downsize the hospital?
If they were to carry out the plans that they've been talking about, which is not to have an emergency room.
Yes.
And to really make that facility more of a long-term kind of a care facility rather than a hospital. It seems to me that that's changing the animal here quite a bit. And my question is, if that was to happen, would we then have a situation where we have a medical facility in a zone that really isn't appropriate anymore?
Well, that type of change would not be able to occur with the type of zoning that we're proposing now.
So you're saying if we rezone this as you talked about it, the hospital has to stay with its current facility and uses? Is that really the overarching aspect of doing this?
With not addressing any potential state laws, the city would not be able to bar the closure of a hospital. You know, we cannot tell a business that you have to keep your doors open. So there's really two options. You have a hospital, or you go out of business. Another hospital could come in. There are other options here. One of the things that we added was the option for a standalone emergency room. So we created a definition of a standalone emergency room similar to the legislation that our representatives are pushing through Sacramento currently. So they could do a full hospital, or they could do a standalone emergency room. So there is an option for that, and that, of course, would require the passage of a state law to allow standalone emergency rooms.
Okay, so then if either that happens, then it would be appropriate for that use with this new zone. Is that correct?
Either a hospital or a standalone emergency room, yes.
Is there with this rezoning, does that actually facilitate the ability to have the facility stay more as it is today?
The current zoning, yes.
Okay. So it would add
easily maintain what they have now.
Okay, then my next question is on this new community zoning. I'm not getting it exactly. I'm very familiar with that part of the neighborhood, and I'm very familiar with the commercial that's there. With this new zoning, would it disallow any uses that are there now?
No.
Does it provide anything new that it wouldn't have now?
It would provide, one example would be group counseling uses, one of these new medical-related uses that we're talking about. It would allow those uses in the CC4 zone, and that would not be allowed in any other CC zone.
Okay, so then my question would be, is there any group counseling outside of this that would be affected by it?
Currently, there may be. I believe there's some in the Rancho San Clemente. Yeah, I think there's one. We do have a number of applications for new ones right now, which are all located in this zone. And it's actually good that you brought that up. One of the things that staff has brought forward after the printing of the staff report and the resolution is we would like to include an amortization clause for uses that would be made non-conforming to the based on this ordinance alone, which would specifically be one in one of the business parks.
Okay, thank you. Mr. Wu?
Hi, Adam. My question is, within that Camino de los Mares focus area, have we studied other sites and see if there's any possible, any other sites that's suitable for a regional medical facilities? Or is this the current one, the only possible that's practical?
Well, we haven't done an in-depth study of all properties, to identify where a hospital could potentially go. We've got a site that is a hospital now, and as my staff report identifies, there's a number of reasons why this is a great place for a hospital. One is that there's already a medical focus in this area. Second is that it's next to a freeway, an on-off ramp. It is also next to a fire station. There's a number of things that really make this a great location beyond the fact that it is a hospital. It's been a hospital for 4 decades. It's in the city's history as a hospital. In the future, though, there may be other sites that could be identified for hospital as well. If that happens, this new zone, regional medical facilities, we could apply to a separate property later.
And in the future, if there's another operator is willing to, open a hospital within that area, and then we can rezone another possibility.
Oh, yeah, absolutely.
Okay.
Yeah.
Thank you.
Okay. Mr. Rule.
Yeah, a couple of questions. One is, you just mentioned a couple of minutes ago, you're going to request an amortization clause be added to this for
Yes.
certain business parks. Can you talk a little more about that? What is the area and the types of uses that you're looking to amortize?
The amortization clause, what we would ask is that that you would, as part of this resolution, direct staff to include, I want to say within Section 1772, the non-conforming section of the code, language that would specify that uses that are non-conforming to this ordinance, because of this ordinance, would have a 3-year time span with which to cease operations, and there would be some language about like a safety valve that, based on the community development director's findings, that if there's some extenuating circumstances that require the use to maintain, that we could do some negotiation to allow an extension of the use, but ultimately we'd be giving a 3-year window to existing uses that are non-conforming. Like I said, I believe there's only one.
Oh, there is only one business?
Yes.
That this would affect?
But additional permits are pending.
The conditional permits that are pending are all in this CC4 zone.
Okay.
So there would be no issue with the pending permits.
And what's staff's purpose in that? I know you kind of want to make it more of a pure CC4 zone, a pure medical office zone. Is that the idea that you feel that's going to be an improved land use in that area for some reason?
Yes. Well, so one of the things that we've done in the
or maybe I could say, what is the problem there that you're trying to solve by advertising this and moving any potential businesses out? Maybe that's another way to ask it.
Well, the issue is that the reason we want to amortize this use is to quickly encourage its relocation into the CC4. The intent of this whole project is to incentivize the maintenance of the hospital site. And, in some cases, we may just allow non-conforming uses to be maintained. In this case, we really want to go, the extra step and do whatever we can to really focus this area as a medical supporting zone. We only have one use, so it's not going to affect many businesses, but it would be one nice thing to just simply clean up right off the bat.
Okay, great. So it's to incentivize that hospital use, to make that more valuable and attractive.
Yeah.
Okay.
And everything, and if I could just add to that, everything that we're doing is incentivizing the hospital use. Part of that is not allowing hospital anywhere else. Right now hospital is allowed in a couple different zones, and as property owners, it's nice to know that now the only place it's allowed is the zone that you're in. There's no competition. Somebody would have to go through a very large entitlement process unless the city identified another RMF zone. This basically cuts out a lot of competition for future hospitals, and that's an incentive, to maintain the site as a hospital.
Okay, good. I did have a concern too that there are some other labs and medical offices in town that I didn't see on the map or being added here. I think that there's some on the end of Vista Hermosa at Pico. Would those facilities be negatively affected by this? Because they would stay at CC2, I would think.
Medical, the labs out in Talega.
Yeah, it's out on, actually on the corner of Pico and Vista Hermosa. There's a medical lab out there and some doctor's offices, that sort of a thing. It's a small memorial care facility.
Yes. So the labs,
I guess my question is that
those would not actually be a non-conforming use. They're still allowed.
They're still allowed in CC2?
Yeah, it's in the industrial zones they're allowed. What we're doing is we're separating out types of labs. We've got, right now, we just have a blanket laboratory, and it's not very descriptive. What we're doing is we're separating out between wet and dry laboratories, wet being much more heavy in like biological, tissues and substances, hazardous materials, things like that. And this will allow us to conditionally permit those uses and allow dry labs by right. But the use will still be allowed in the zone.
Okay, I just wanted to make sure that we weren't causing problems outside that zone. I also noticed down in section 11, you've got the new definition for research and development, and that appears to be focused on high technology and medical. And I'm just wondering if we might have some unintended consequences, because there are other businesses, even athletic apparel has research and development in terms of, new shoes and new socks and things like that. Are we maybe having some unintended consequences here by saying that that other businesses don't do some level of research and development?
We have some definitions for research and development right now in some of the specific plans that are substantively similar to what's here now. This is actually a little bit more descriptive. The difference being that the existing definitions are antiquated. They talk about old technologies. This is something we could potentially revise if there's certain industries that you would like to include here. I think there's enough leeway in this definition that that staff would be able to work with some applicants that would propose this type of use, to identify similar uses. I can think of one recent research and development use that we had discussed was the Stance socks. They had research and development as part of their application. This is really talking about development of creation of prototypes, things like that. That's what the examples allude to. The examples are just there so that staff and the public has some idea of kind of what is research and development. This is not a concrete list that if you're not on this list you're out. But if it doesn't seem to allow a breadth of options, we could always add some more language to it.
I'm not sure. Maybe our attorney can chime in. I just wanted to make sure that if a company comes to town and they do car parts, but they do research and development in that area, that for some reason they weren't restricted or had some particular advantage or something like that. So on your reading of this, is there any issues that we might have to be concerned about with there? I know I'm speaking a bit generally, but...
No, Mr. Chairman, Commissioners, so on page 16 of attachment to the definition of R&D, the first sentence really gets to your point, which is it uses the phrase technology-intensive fields, right? Then the next sentence includes the examples that Adam alluded to. And importantly there, that includes the very important legal language, including but not limited to, right? So if we wanted to have a broader definition, we could simply excise the term, or the term technology-intensive fields, and your list of examples really gets to the point that we want a broad definition, but not so broad that anything that could be researched, a better donut, for example, doesn't qualify here. But that it's getting to things like Stance socks, automotive, and then the examples listed. And so we can have a broader and yet still narrowly defined definition by having that list of examples, but excising the technology intensive, if that was the Commission's desire.
Okay. I don't want to put I'm maybe putting too fine of a point on it, but I just want to make sure that we don't restrict these people who are, outside of the software or medical fields, that sort of thing. I might be a little more, maybe you could, work up a few words of text so when we get around to discussion, we can talk about whether we think that's a good idea or not.
Okay. Commissioner Eggleston, you've been waiting patiently, but Commissioner Rulon went through his
extensive
questions.
Thank you. This is a question for the attorneys. The hospital owns this piece of land that we're going through a general plan amendment and a zoning amendment here. And every time we go through a general plan amendment, a zoning amendment like this, and a property owner owns a piece of land that they want to perhaps change the use of in some manner, will this involve anything with regard to property rights?
Mr. Chairman, Commissioners, everything that we do at the Planning Commission level involves property rights. And that claim could certainly be made, and it could certainly be made by anybody who doesn't like what a commissioner or council does. So I could never guarantee that an action you take wouldn't result in a claim filed. That said, we feel confident, based on the original zoning and general plan designation from 40 years ago, up until it was recently changed, that the city is well within its rights to perform the actions that are being proposed by staff tonight. Does that answer your question, Mr. Commissioner?
Thank you.
Okay, Commissioner Wu, we're working back to the left here.
Adam, a little question. In the definition on page 14 of attachment 2, we have the definition of a standalone emergency department. And then on the usable table, we list ambulance service. Are they the same thing?
No, those are not the same thing. An ambulance services would be a service that provides ambulances, within a city. So it'd be a depot where there's ambulances, and they would dispatch, to pick up people and drive them to a hospital. The standalone emergency room is not listed in the use table because it's listed in the definition of hospital, and specifically, the use table says a hospital is allowed conditionally. And so when you go to the definitions to look up what is a hospital is either a general acute care hospital as defined by Health and Safety Code, or it's a standalone emergency department. And then we reference the following definition.
Thank you for your clarification.
Mr. Smith, you want?
A couple of clarifications. So I'm assuming that this new zone does not apply to dental offices. Is that correct?
Regional medical facilities?
The CC4 zone.
No, they would be
So you
allowed.
could, in other words, you can have a dentist office in other locations in town.
You could have medical offices in a lot of locations.
Okay, is it also that you can have medical offices with doctors in other locations?
Yes.
Okay, thanks.
Okay. Any other questions of staff this time? At this time, we have basically kind of an applicant request, which is from Mr. Tony Struthers, is one of the cards. He's the administrator of the local hospital. Staff approached me the other day about he could have a 10 minutes block to talk to us, and we have agreed to do that. And so I also like to disclose that Mr. Struthers and I are on the board of directors of the Boys and Girls Club together, and that he and I also met on this subject, so that to disclose that.
Mr. Chairman, I'd like to also disclose that I had a conversation today with Mr. Struthers.
I will also disclose that I had a conversation with Jennifer Fitzgerald on this issue.
And I would also like to disclose that I, too, had a conversation with Jennifer Fitzgerald on this matter.
Okay. With that, Mr. Struthers, would you come forward and give us your best?
Thank you, and I hope not to take the whole 10 minutes. My name is Tony Struthers. I am a resident of San Clemente and also the administrator of Saddleback San Clemente. Thank you, Chairman and Commissioners, for hearing me out this evening. On behalf of Saddleback Memorial Medical Center, I am here today to express our frustration and dismay at the proposed zoning amendment put forward this evening. For over a year, we've been holding open meetings, speaking with community groups and leaders, and collaborating with the City of San Clemente and many others to support statewide legislation that will allow us to operate a satellite emergency department for San Clemente. In spite of this effort and outreach, and while the state legislation is still pending in Sacramento, this new uncalled for and extraordinarily restrictive rezoning proposal has emerged. If this zoning amendment is recommended to the City Council, we will provide written comments detailing our concerns regarding the legality of the proposed rezoning. But for the moment, however, we have pressing questions about the proposal's intent and effect. First, we must ask why this rezoning is needed at all. Why rezone? The current zoning provides for hospital and other related medical uses. Nothing in the staff report suggests that the public would benefit by constraining the available options for medical services and forestalling a state-of-the-art new ambulatory health care facility. The general plan, our community's binding document, emphasizes the need for flexibility in the face of changing community needs and a transforming healthcare industry. This rezoning would serve only to curtail our potential value to the community and the practical value of our property. In short, we perceive no positive purpose to this rezoning. Second, we ask why this rezoning is being put forward at this particular time. Why rezone now? It is well known that Saddleback Memorial is working closely with state legislatures to allow a satellite emergency department on our San Clemente campus. This effort was sparked by our extensive discussions with residents and community leaders in San Clemente about the importance of preserving medical services for the community. Yet the proposed rezoning, which details specific requirements of this satellite emergency department option, hinges on the pending legislation. Why not wait to learn what options will be legal? Why detail 11 criteria for satellite ER without knowing if these factors will reflect eventual state law? We see no reason why this rezoning is suitable now, and ample reason to, at the very least, postpone consideration until the legislative process is completed. Third, what does this rezoning seek to achieve? What is the real motive? Not only is the proposed rezoning without a clear public purpose or benefit, it substantially harms our property in particular. It would be outrageous for the City Council to seek to acquire our property by leveraging its zoning powers. Using this rezoning to restrict the health care services we can offer the community and to lower our property's value, and thus the price the council will need to pay to acquire it, would both be immoral and illegal. Fourth, why no notice? Why has Saddleback Memorial not been provided with notice of key proceedings in the development of this proposal? Contrary to what was stated in the staff report, no notice was posted at the hospital, nor were we informed of a November 18th workshop discussing these proposals until after the meeting took place. We are upset and saddened by the city's lack of transparency, particularly given our extensive outreach concerning the property's future. It is important for this commission and for the community at large to recognize the reality that continued operation of an acute care hospital at this location could be unsustainable. Over the last several years, we have seen a declining inpatient census and shrinking surgical volumes on the San Clemente campus. These declining trends are consistently locally, regionally, and nationally, placing an already small campus like San Clemente at particular risk. We have and continue to dedicate ourselves to advancing state legislation to allow for a satellite emergency department on the San Clemente campus. Additionally, we continue our vision for a state-of-the-art new ambulatory care campus that would expand healthcare services available in the community in a convenient one-stop location. Such a new innovative facility would be designed with the patient and community in mind, delivering convenience and high-quality care, something the community would be proud of. The proposed rezoning would effectively destroy that vision. Narrowing the permitted medical-related uses on the San Clemente campus would restrict our options for meeting the community's healthcare needs. We are also gravely concerned that it will prove operationally and economically infeasible to maintain that campus in its current form in light of its declining use. We will be exploring these concerns as we await the results of the pending legislation. Finally, to reiterate our questions, why rezone, why now, and what is the motive? And finally, a question I have for the planning staff and for the commission is that let's assume that the legislation passes and a freestanding ER is available. Will we be able on that piece of property to also provide outpatient surgical services, imaging services, laboratory services, cancer treatment services, and other services? Maybe I misread it, but the potential is it's an all or nothing thing. It's either a hospital or a standalone ED, there's nothing in between. And so I really think at an absolute minimum, you have to take a look at the way healthcare is changing and really look at that and decide if that's the right thing this community needs. So with that, that concludes my formal remarks, unless you have any questions for me at this time.
As we kind of consider this an applicant's 10-minute window, do we have any questions of Mr. Struthers at this time? Mr. Eccles.
Yes. Under the definition of hospital here, it means either a general acute care facility is defined by Health and Safety Code Section 1250A that provides a wide range of emergency, clinical, and temporary medical services to the general public, or to the extent permitted by law, a standalone emergency department as defined in Chapter 17.88 definitions of this title. It does not include any other health facility identified by Health and Safety Code Section 1250, nor does it include any other type of specialty hospital. What you are proposing to do is in opposition to this definition. Is that correct?
Yeah, our ultimate vision would be in opposition to that.
You're
assuming that the legislation doesn't go through.
So, but your vision is to have an ambulatory healthcare facility.
That's correct. We don't believe that the inpatient beds of the acute care hospital are necessary in the future.
That's the exclusion that you're talking about here. In-care bed facility.
Inpatient beds, yes.
Inpatient facility. But you would be considering at some point a standalone emergency.
Absolutely. We've said publicly that if this legislation goes through, we absolutely would do what we're calling a satellite emergency department. But in addition, that would be the cornerstone of a bigger project, we hope, which would bring additional ambulatory services to the community, such as an outpatient surgery center and things like that.
And how would that, and how would what you're envisioning here for a standalone emergency differ from what you currently have?
Right now, we have inpatient beds.
No, but as far as just specifically for the emergency.
If what we have now versus what we're talking about, absolutely no change. What we're offering today versus a standalone emergency department is very similar.
So would there be any exceptions to what you have today as far as your emergency room?
Once again, without knowing what the final legislation looks like, as it looks today, it's very similar to what we offer today. But obviously, that bill can go through amendments and go through the legislative process, and that's really out of our hands at this point.
Well, at this point, it's supposed to go through a Senate Health Committee in January.
That's correct. Potentially, that's correct.
You mentioned that there was no notice at your hospital. There was no notice posted at your hospital?
Not that I'm aware of, sir.
Okay. All right. Thank you.
Mr. Rulon.
You mentioned that the zoning amendment substantially harms your property value and lowers its value. Could you be a little more specific in the ways that you think that this harms your value?
Well, if you're talking about an all or nothing situation where it's a hospital or nothing else, and we feel, and we've said publicly, that the long-term use of that facility probably isn't best used for a hospital, then if we don't feel that we can operate a hospital continuing down the road, we have no option but to not have any services on that piece of property. It's either you have a hospital or you don't have a hospital. There's no in between. For example, let's just assume that it's an assumption that the legislation doesn't happen and the decision is made by our board that we decide to cease operations on that campus. We wouldn't be able to offer any services on that campus like an urgent care center to provide any type of backfill services for the residents of San Clemente if this goes through. So it really is tying our hands into any type of future services we could ever do on that campus, because if we decide not to have an acute care hospital on that campus, with this rezoning, we can't offer any services on that campus because it's not an acute care hospital at that point.
Then what would your options be?
Nothing.
It would
be an empty lot at that point, I suppose, because if we can't operate a facility, and that's the only thing we can operate on it, then once again our options are absolutely limited at that point.
Okay. And one more thing, I think I heard you answer it with Commissioner Eagleston, but I want to make sure that I understand. The legislation, at least as you understand it now, and I understand it can change and that sort of thing. As you understand it now, there's nothing in the legislation that's contrary to what's in the zoning, what's in this proposed
No,
zoning
actually,
amendment?
I believe the language is actually lifted directly from the bill.
So the bill that you are, and you support that bill as it is now. So the bill that you support is in line with the zoning amendment, but you don't support the zoning amendment? Do I have that right?
We don't support the zoning amendment because it's an either-or situation. It wouldn't allow us, even if all we could have on that is around it. And we haven't really taken a look at without other services helping subsidize those services. The emergency room is a place where we provide care to all residents, whether they have funds or not. So it's always services.
So the bill, as you understand it now, is much the same as the zoning amendment, except it would give you more flexibility? Is that what you're saying?
No, I'm suggesting that the way it is, the zoning amendment that I'm aware of, the way it's put together, it's either you do a freestanding emergency department or a hospital, but
Different.
well, things. I mean, just because it says standalone doesn't mean you can't surround it with other services. In fact, we would try to, surround it with other services.
So the bill would let you add other services?
It wouldn't prevent us. How about that? From having
Okay,
other services.
thank you.
Mr. Wu.
Hi, Tony.
Hi.
I'm not sure your understanding of that development potential is what we are proposing here. My understanding is the proposed development standard gives you much greater opportunity to develop this site because the other uses you are mentioning, such as medical services, medical offices, they are listed on the table. They're permitted as long as you have either a hospital or standalone emergency room as an anchor. Then all the other things can happen as accessory uses. And the proposed development standard raises the FAR substantially from the existing condition and the building height. So in my viewpoint, if you keep a minimum size hospital with emergency room, then there are lots of potential for you to develop the rest of the site to include those medical services, including the ambulatory surgery centers and other things. Is that correct, as the city attorney may weigh in?
Mr. Chair, Commissioners, that's correct. The table is actually on attachment 2, page 5 of the report under section 2 of the table's hospital uses. It allows for accessory uses to a hospital and provides a series of examples, not exclusive examples, but general examples: laboratories, medical offices, floras, parking lots, etc. So I think Commissioner Wu's understanding is accurate.
Yeah, the table does call that out.
With the standalone emergency, how do you propose that would work if you don't have any hospital beds to put patients in after you have emergency treatment? How would that work?
Much like we do for certain patients today, we would put them in an ambulance and transport them to another acute care facility.
You do that in all cases?
Not in all cases, because right now we have inpatient beds, but we do transport many patients to other facilities that need specialty care and certain inpatient services we're not able to provide on that campus. For example, cardiac, stroke, we don't provide OB services on that campus. And we have our own medical transport program which takes care of that.
But nevertheless, you said that you would provide some beds, some hospital beds?
No, we currently do is what I said. Under this proposal, we wouldn't, obviously, a freestanding emergency department would not have inpatient beds.
Oh, okay, thank you.
Commissioner
Blackwell. Yes. Hi, Tony. So, would you have outpatient beds?
That could be allowed under outpatient, meaning they would probably stay under 24 hours. We call those observation patients, so it's a possibility to have something like that we'd have to get that clarified through the Department of Health. They're the ones who will ultimately provide those regulations for us.
So currently, it's your understanding that patient bed?
Yes.
Okay. And
it's a possibility with you. We're really focused on the legislation and really haven't looked at other alternatives for the use of the building at this point. So.
Okay. And would you mind briefly, just again, if I missed it, I think I did, walking us through some of the other services that you have in mind that you've mentioned a couple times?
Right. So, I mean, the emergency room have diagnostic imaging, a breast imaging center to be able to do mammography, an outpatient surgery center, potentially outpatient cancer treatment centers, and physician offices. So, and therapies and things like that, community education centers, really an outpatient-oriented, non-inpatient facility. So.
Okay. And then the next part of this question is for Jim. For all those services just mentioned, what would be the internal process and permitting process for those uses?
Was it ancillary?
Yeah.
Mr. Chair, Commissioners, those are all permitted uses.
So it'd be by right, basically.
Yeah, it's by right in the table.
The only discretionary would come in if they were building new structures and require architectural review, but it's by right.
Okay, thank you.
Okay. Mr. Crandall.
To keep it simple, is there any land use zoning that would, that you can see that would make it economically viable for your hospital or the emergency room that isn't being considered?
No. I mean, I don't think, it's not a matter of zoning. It's a matter of the marketplace. It's the healthcare way, the way healthcare is changing, and that's really the effect that we're seeing. Has nothing to do with the zoning. What this does, though, is it will restrict our options for the future, because, I understand that in the past it was a hospital only, but I think the foresight of the GPAC and really looking to the future of healthcare, I think they spent a lot of time talking about the way healthcare is changing. I thought they were actually pretty forward-thinking, and now we're basically going back in retro zoning, going back to an old time when, as a matter of fact, the current zoning actually fits the needs, in my opinion, of the healthcare needs of the future of San Clemente much better than a hospital-only designation. And we believe that we're in the healthcare industry. We see those trends. We believe that we know what those trends are.
Okay, if there are no more questions of...
Thank you, gentlemen.
Mr. Strother, I'll close the applicants as we so...
I just wanted to clarify the last question, because the ancillary uses are allowed by right, but the hospital use is conditional. So it would all be considered together.
Yeah. Okay,
So, I'm sorry, so under this zoning amendment, hospital would be required and beds would be required, is that correct?
Adam, is it bed?
Are the beds required under this hospital use?
Which table are we looking at?
It refers back to state law, and the state law would reference the fact that there be beds. That's part of the...
Well, is that the definition that I read before?
It's not in our definition.
But is it the definition of the Health and Safety Code, Section 1250A? As hospital means either general acute care facilities defined by that, provides a wide range of emergency, clinical, and temporary medical services. So, I mean, I want to be very specific here. So what we're doing is saying that, in fact, this particular hospital, what we're doing is that they must have a hospital with beds. Is that what we're saying here?
If they are a hospital, then they would have inpatient services, and inpatient services are having beds for people longer than 24 hours. So
it's longer than 24 hours?
if it's less than 24 hours, then it's outpatient.
Uh-huh. All right,
Please
thank
hold
you.
it down in the back. Please hold it down in the back. Thank you. I'm going to have one conversation because I think you have very important questions there.
That's a big, and for me, at least, that's an important distinction of what we're trying to do here.
At this time, I'd like to open the public hearing. Okay, and start with Nancy Hunt, followed by Stephen Allen, followed by Dr. Nick Cordalius, or something like that, followed by Dr. Gus Garamas.
Shall I start? Okay. That's all right. That's all right. Thank you for the opportunity. I won't take that much time anyway. Thank you for the opportunity of addressing you, Chairman Brown and Commissioners. I am Nancy Hunt, and I've been a resident of San Clemente for 40 years, and I'm a former GPAC member for the committee. But I come to you with a letter from which I think you're all in receipt of, from the Chamber of Commerce of San Clemente, their board of directors.
We are.
And yes, you do have that, right. And written by Lynn Wood, our CEO. Dear Chairman Brown, the San Clemente Chamber of Commerce respectfully requests the planning property located at 654 Camino de los Mares as RMF1. The current zoning allows for current use and potential future uses as an ambulatory care center. This rezoning would seem to seriously hamper this business' ability to stay current and relevant with the changing healthcare landscape. Rezoning at this period of time seems to be in conflict with the city's stated objective of supporting the existing legislation in Sacramento. The definition of standalone emergency center could change if the bill gets admitted. Once again, the recently adopted general plan is being revised after a property owner expressed a use for the property that fits the current zoning designation. We feel this puts the GPAC process aside and ignores the hard work and effort that went into revising the city's general plan. This could also put the city into another potential legal situation if Memorial decides to exercise their property rights. Thank you for your consideration in this matter and for your continued commitment to the city of San Clemente. Sincerely, Lynn Wood, CEO, and thank you very much.
Thank you very much, Nancy. Mr. Stephen Allen.
It's Steve Cullen. Thank you. I apologize for our tardiness. We thought that the meeting started at 7, so we apologize for walking in later. I wanted to clarify some of the things that Mr. Struthers said. He suggested with his opening remarks that the city has some ulterior motivation for this zoning proposal change, and that their methods may be underhanded. He suggested that they weren't aware of the workshop on November 18th, but Mr. Struthers was with me on the dais at that workshop November 18th. The reason for this proposed amendment is to save lives. Memorial Care has had an opportunity for the last 16 months to have a role in discussions coming up with an ulterior solution to the problem that we face, and they've chose not to participate, or when they did, they chose not to provide information that the city requested of them. Honestly, to suggest that there's some ulterior motive, I think, is an insult to Mayor Baker and to past Mayor Ham and to city manager and the assistant city manager, who all have spent a lot of effort and time, as we have in the last 16 months, trying to save the hospital. The truth is that Memorial Care wants to close the hospital. Memorial Care can make money running the hospital, but they can just make more money building a three-story office building with outpatient services. These days, you can make more money in outpatient medicine than you can in inpatient medicine. But they're a nonprofit facility, they're a nonprofit corporation, and they do well to the tune of $300 million a year. They know how to run hospitals, and they can do it, and they have purposely driven down the census in the last 2 years to justify what they want to do, the changes that they want to do. I think that in the Planning Commission's mission statement, it says that part of the ideals are to save historic, natural, and city resources. And Mr. Mashkinoff said at the workshop that the definition of planning includes works to improve the welfare of the people in the city. Lives are at stake here. And the proposed legislation is only for a freestanding emergency room, nothing more. And Mr. Struthers knows that that legislation is going to fail. The city knows that the legislation is going to fail. There's too much opposition. The SEIU, the California Nursing Association, the ER physicians, the California Hospital Association, the same association that they're a part of, is opposed to this legislation, and it will not pass. And the proposed amendment that past Mayor Ham and Mayor Baker have asked you guys to make is to save the hospital, to save lives. It's impossible to catch you guys up on the last 16 months of meetings and arguments. All of us have been back and forth to Sacramento a few times. All of us have been to many city council meetings and many meetings, public and private. And certainly if you guys have any questions, we have all those facts and numbers memorized, and we can answer any of those questions. But the simple truth is that Memorial Care chooses to close the hospital. They're a 501c3 nonprofit organization, and they're choosing to ignore their mandate. They're simply choosing to close the hospital. An emergency room can still make money, and so if they have the opportunity to have a freestanding emergency room, they will. But if not, they choose not to provide inpatient care anymore in San Clemente. They have a foundation for Saddleback Hospital that has $131 million in it, and last year they spent less than 1% on charitable causes, and none of that money was spent in San Clemente. If they're going to have a facility here in San Clemente, if they are going to suggest that they are a nonprofit charitable entity, and if they are going to use the money from San Clemente citizens and donations from San Clemente residents, if they're going to take that money and simply choose not to provide any services to this city, then someone needs to hold them accountable. And I think that what Mayor Baker is doing, what past Mayor Ham is doing, is trying to hold them accountable and trying to say to them that San Clemente needs a hospital, that an emergency room, a freestanding emergency room, is not going to happen. Again, they know this to be true, and that simply closing the place down is not acceptable. Memorial's plan is for a 3-story office building, and it's not necessary on that street. You know, there's 7 buildings on that street already, and they all have vacancy signs in them. The one that doesn't is the one that Memorial Care occupies now, and certainly they're going to vacate that building when their new building is built. And then you have 7 large buildings across the street with even more vacancies. They've already wooed other doctors from those buildings to come live in their new building. Thank you.
Thank you very much, Doctor. Next, Dr. Nick Carvalhos. Did I pronounce it right? Yeah. Your handwriting is like mine, I think. I can't read mine either.
Thanks for having me. I wanted to...
Could you speak by the microphone, please?
Oh, sure. Sorry about that.
Thank you.
Done this that often. I wanted to address a few issues regarding keeping the hospital open, and actually what the difference is between closing the hospital and keeping the hospital open. Their proposal basically doesn't really provide any services that we don't already have. We have outpatient surgery, we can do outpatient chemotherapy, we have outpatient radiology. What it does do is close the emergency room and close the acute care hospital. And these are necessary services in this community for reasons that we've delineated over and over again. The covenant that Memorial made with us as a 501(c)(3), we actually required them to keep an acute care hospital open. They actually agreed to that in their contract for so many years. And they're trying to renege on that agreement for reasons we're not sure. Their own mandate in currently, if you read their current mandate, makes a note that the elderly community is underserved in the emergency rooms, that there's not enough hospital beds, and that's one of the charters of their 501(c)(3). I think it's important to establish why this rezoning is so important. It does keep the hospital open as an acute care facility, which is a necessary entity. That's the positive purpose, and I think to Steve's point, it saves lives. The second thing is, knowing full well that this legislation for the freestanding ER isn't going to be approved, it keeps them from closing the hospital without notifying you guys. And when they first threatened to close the hospital so many months ago, they didn't give us any notice, the physicians. They just said, we're going to do this on such and such date. And then we set up an organization to oppose this in order to educate the community so that we could save lives. So our motives are to keep the hospital open and the emergency open in case somebody has a heart attack. If someone does have a heart attack in this community, you want to go to the closest facility, get stabilized, and transferred. That happens all the time there. And our mortality rates with that were lower than Mission's and even their hospital as far as cardiac survival rates were concerned. And they included the transfers. Finally, I think his promise is a bit of an empty promise. I understand they're promising outpatient facilities and state-of-the-art care, but state-of-the-art care is a mini hospital where families in the community can go and see patients nearby, and having an ER in case your child is drowning, in case you're having a heart attack, a pulmonary embolus, if you're having an acute rupture of an aortic aneurysm, anything can be taken care of there. At the end of the day, an expansion of ambulatory services for them is basically the same thing they have with an urgent care. We already have 4 urgent cares. So it doesn't really do anything for us, and it doesn't really fulfill their mandate. Guys have any questions?
Thank you, Doctor.
No questions?
Do you have a question there?
Yeah, Doctor, I have a question.
Yeah.
To your knowledge, what is the next available emergency room if this emergency room to be closed?
It would be Mission Hospital.
Mission Hospital. How many minutes does it take? How many additional time does it take?
About 9 to 10 minutes extra.
9 to 10 minutes.
Provided there's no traffic.
So if there's somebody having a heart attack or stroke, 9 to 10 minutes is the difference between death and life.
1 minute is the difference between death and life.
1 minute. Thank you.
Thank you, Doctor. Dr. Gus Columbus, and for another, for disclosure, Dr. Gus and I are also on the board of the directors of the Boys and Girls Club, so.
Thank you. Thank you for allowing us to speak. First, I want to applaud our city council for being proactive. Like Dr. Cullen said, most of the folks up in Sacramento oppose it, although I must say the California Hospital Association isn't for this legislation. They're not against it, they're staying neutral. So that was the correction that I wanted to make sure that everyone understood. We owned the hospital. Doctors owned this hospital from about 1999 to 2005. We sold the hospital to Memorial Care, Saddleback Hospital, when we worked with Barry Arbuckle, the then CEO of Saddleback Hospital. In our contract, we said, we want this hospital to stay open as an acute care hospital and emergency room for this community. That was our intent. That was written in the contract. We had options to sell to other entities at that time, and we chose a not-for-profit because of their stature in the community, their stature in the community. They're very well-balanced. They make a lot of money. They've been here for 100 years. They're a good company. And so we understand that they're a good company and know how to make money in healthcare. But the intent of the property was always an acute care hospital. If you're not sure, let me read you some of Memorial Care's own words. We're not trying to come here, and I quote, we're not trying to come here and make a lot of draconian changes. Saddleback CEO Steve Geit, 2005. Here's another one. Quote, the hospital runs very well, and we need to take what it does well and make it stronger, make it bigger. improve its financial position, that kind of thing. We want to tap this place for what it does well. Steve Geit, Orange County Register, February 11, 2005. Here's another. I look forward to overseeing the growth of the hospital as we continue to see more and more patients. I will be working closely with existing management and physicians to implement new services to better serve our community. Tony Struthers, Administrator, San Clemente Hospital, Memorial Care Press Release, January 4th, 2010. The emergency department at San Clemente is a well-run service and is a source of significant amount of value provided to the community. It also represents the lion's share of admissions to the acute care service hospital, with an average of 85% of all inpatient admissions being through the emergency room. Here's one from the Los Angeles Times. An updated national report on U.S. emergency medical care has again awarded California an F for lacking access to speedy treatment, noting that the state has the lowest number of hospital emergency rooms per capita in the nation. This is the Los Angeles Times, January 15, 2015. We have serious threats in this community. Earthquakes, songs, waste perhaps, terrorist attacks, transportation accidents, drownings, heart attack victims. Time is everything. Time is everything. This is an important step for our city to consider. Saving lives. Thank you.
Dr. Gussa, one question.
Yes.
You said when you sold the hospital.
Correct.
That they signed a contract with
Correct.
you. Is that
Correct.
contract still in effect?
The contract that we placed with Memorial Care was that they would keep it open for an acute care hospital for a limited period of time. I think we tried to get that extended. I think that number has run out at this point. But what that does, it tells our intent. It tells you our intent, and our intent was to keep emergency services and hospital here in our community. By the way, our SOS, our Save Our Hospital committee has formed and received a beautiful rendition of what this place could be. They could have their outpatient center, their 3-story building, outpatient services with the win-win proposal that you can see on our website, savesanclementehospital.org.
Thank you.
Okay?
Yeah, appreciate your time.
Thanks, Tom.
I just have one question of the doctor.
Okay, yes.
Do the majority of doctors that you belong to there, your group, have the same philosophy and feeling as you do with regard to the hospital?
I think many of us do. I think there's a few that oppose our position, but I think the majority of those of us not working for Memorial Care definitely agree with what we're saying. And in fact, many of those Memorial Care physicians have quietly given to our cause, quietly because they're afraid of any kind of retribution from their employer, Saddleback Memorial.
Thank you.
Are there any other cards on the hospital issue? I want to close the public hearing on thank you.
I came at 7 o'clock to talk about the medical marijuana zoning issue. On the website it said the meeting was from 7 to 11, that the 6 p.m. study time was canceled and the meeting went from 7 to 11, so I arrived here at 7 p.m. to speak. So I'm asking you to possibly reopen the issue so that maybe I can speak concerning the, my concerns regarding your guys' recommendation that you guys are giving to the city council. So I came here at 7. If you guys check the website, it says that there was a 6 p.m. meeting that got canceled, or a study session that got canceled. The meeting was supposed to be from 7 p.m. to 11 p.m. I would like the opportunity to speak and for this to be reopened so that our constituents can actually, address this issue if they like. But if I'm the only person here to talk about the medical marijuana zoning regulation, at least my opportunity to, two things. My opportunity to speak regarding the issue, and after you guys hearing my reissue, then to cast a revote to...
Mr. City Attorney?
Mr. Chair, Commissioners, we checked the website. It does accurately state that the meeting started at 6 p.m. That said, in abundance of caution, for Brown Act purposes, I would recommend at new business item number 9, allowing for that comment to be made.
Okay.
If the commission wishes to reopen that, there's always a motion to reconsider available to the commission after the individual has made his comment.
Just a point of discussion, it was a recommendation to City Council, and it will be an open public hearing again there where the decision will actually be made. So there will be the opportunity for this gentleman to speak in public to the group that is actually going to make the decision. What we did is we made a recommendation to City Council. City Council will be having another meeting that is open to the public, and you'll be able to speak there, and they actually make the determination. All we do is make a recommendation. So that will be available to you and anyone else who chooses to speak at that meeting.
Okay. Are we,
So you guys are denying the motion to...
Well, we're in the middle of a deliberations right
we're in deliberation on another subject.
We're in deliberations right now on the hospital.
Do you want to open it up now? You recommend you open up 9B for new business, Lenny?
My recommendation is the appropriate time to discuss this would be after the public hearing is concluded.
Okay.
During item number 9, we
Okay,
can
then we'll do it
revisit
then.
this issue and address the individual's
We'll do it then.
request.
Okay. Late night. Okay, with that, we'll close the public hearing on this particular item and go into discussion. Commissioner Rulon, I think you wanted to...
Yeah, just really before we start discussion, I wanted to make, I think, an important observation. I heard from, we heard from Mr. Struthers, and also in my conversation with Ms. Fitzgerald, they stated about how the GPAC, the General Plan Advisory Committee, and the general plan was about moving forward, and kind of at least a strong implication is there about how we are, the GPAC was kind of visionary in saying that we could remove these services. And I was on the GPAC, I was on the Planning Commission while we talked about that. I was at almost 80 public hearings, and I can assure you that is not what the intent of the GPAC. In fact, their intent was to increase medical services, and they increased architectural overlays in order to try to do that. So before we jump into our discussion, I wanted to make that clear, that in the general plan, in the discussions, really the idea there is to provide better and greater medical services to the community.
Okay, thank you. With that, Commissioner Crandall, you want to your lights on?
I guess I'm the only one with the light on right now, so I'll get my feet wet. It seems obvious, I think, to everyone that the residents of San Clemente want a critical care hospital in San Clemente, and be it this hospital with this operator or any other kind of facility, I think the citizens are right in their desire to have that. I think it's clear that this is, to me, that this is a move to try and keep the hospital where it is and operating as a critical care facility, and I think the majority of people would like to see that, although we can't make businesses viable by just zoning. And I understand that. I'm kind of curious that I'm having a hard time judging between what people say. We've gotten conflicting comments, and help me out here, Mal. At some point, if we get too many conflicting statements, can people be sworn in to concur their statements? I've read that somewhere. No, I'm serious. I mean, I want to get a straight answer from...
Mr. Chair, Commissioners, I'm assuming the reference is to the public comment that's been made. The answer in short is no. The commission in this instance is sitting as a quasi-judicial body, so you're essentially judge and jury. Now, the comments that are made, if there's a challenge that would happen subsequent to a council decision, would be taken into consideration by a court. the veracity of the comments really isn't what's dispositive. What's dispositive is whether a reasonable judge and jury, in this case the Planning Commission, could base its decision on what you heard, weighing in the balance your take on those comments. And so it's not for us to swear people in, but it's for you to weigh the evidence that you hear, and if your decision is reasonable, then it can be upheld.
Okay, very good. And I want everybody to comment, is it even a viable option to consider if there was another location for a hospital and there was competition for property, would these guys keep their hospital going so they wouldn't have competition? Rather than precluding any other location for a potential hospital. And if the answer, after discussions, is no, I think this is the only site, I'm more inclined to concur that in the short term this might be the way to go. But I think if there's another site, maybe competition would be the best way to get this thing resolved, although I don't know of a site, can't think of one. Because it sounds like he wants to create a business building. And he's not the applicant. This is the city is the actual applicant for this this item. And we're making a recommendation for a change that doesn't change really the use of the property. It's remaining the same. It's not being downzoned. It's being limited, certainly, in what can be there. But the findings that we are obligated to make with the testimony tonight seems like if our goal is to maintain a critical care hospital, this is probably a not necessarily the only step, but a step should the city council choose to take it. But I'd almost like to see if research continues on after whatever happens this evening on should we have a few more sites available for a hospital that maybe somebody will convert into a hospital. If this one and this owner isn't so inclined.
Okay, thank you. Commissioner Wu.
Yes, I think the access to emergency room is almost a basic service, such as police service or fire department. So I think there's a overwhelming public interest to be advanced by rezoning this this area, including the site, to a hospital zone. And some public comment mentioned spot zoning. I'd like to address that. Of course, I'm not a legal expert, but based on my understanding of a planning law, first of all, some spot zoning is permissible. Not every spot zoning is illegal. And secondly, to be called a spot zoning, it has to be a small island created in an incompatible ocean of other land uses. In the case we're proposing here, the hospital zone and the surrounding CC4 zone, they are mutually supportive, and they certainly meet the policy and the goal of the general plan. Therefore, I don't, and also the proposed development standard on the hospital zone is actually less restrictive. Well, there are some restrictions on the use, but they are also more generous on the development standards on how much can be developed on the site. And overall, I think it's a reasonable proposal, and it does not negatively affect the property rights too much. So for that rationale I stated, I'm fully supportive of this proposed rezone. But for the rezoning issue, maybe the city attorney can give us a little more insight on that, on the spot zoning. Somebody accuses of spot zoning.
Mr. Chair, Planning Commissioners, Mr. Wu essentially quoted from Curtin's land use. There are, of course, additional criteria that are reviewed by attorneys, by judges that also come into play, but we've certainly looked at these issues, and as stated previously, feel confident with the city's position should the commission choose to recommend approval to the council.
Mr. Black.
Okay, so simply, in the interest of the public health, safety, and welfare, I believe that this proposal, this recommendation from staff is very important, and it's imperative that it moves forward to council for approval. There's no other opportunities in town, and I think, you know, the 5 to 10 minute drive from Estrella and the 5 to Mission Hospital is a stretch. I do that drive frequently. I have 3 girls in my family. They love them all. It's right next to that hospital, and it takes 20 minutes. Maybe a little faster for an ambulance, but I think 5 minutes would be a stretch. So with that understanding, even at 5 minutes, lives are lost. The opportunities for light zoning in other parts of town, proximity to primary corridors, this is it. This is the one spot. Would there possibly be opportunities in the future with new roads connecting, et cetera? Possibly, but we can examine that when we get there. And I think I could name one area in particular that might be a good candidate. But for now, what we have is an important decision, and it is regarding this project and this property that we need to maintain it. The property owner has opportunities and mechanisms to enhance the use. It's right, it's clearly defined, and I think that with that understanding, it is a very, very strong proposal, and I'd like to see it go through.
Commissioner Rulon.
Well, my colleagues, I think, have kind of made the point about the importance of this as the land use aspect of this and its importance to the community. There's no question, you know, police, fire, hospital, there's a compelling community interest here to have some place where we can build an emergency room and a hospital and have that for the health of the community. So I think that's kind of a hands-down obvious thing for us. So I won't go into that anymore. I will, Bart, to answer your question or address your question, at least from my perspective, is there another viable location for the hospital? I think in the general plan we looked at that, and that's one of the reasons why we had the overlay zoning for the Estrella Shopping Center. At that time, the remodel of that wasn't on anyone's radar. The thought was even that was a larger site and would actually allow for an expansion of the hospital if that was desired. I don't know of any place in town right now that is close to a viable alternative, which really leaves this place. And in this location too, the medical uses have built up around it, around the hospital, the various offices and, you know, freeway access and that sort of a thing. So also when I look at the zoning amendment and what's been said about it in terms of the bill that the hospital is actually in favor of, this is right along the lines of what they're in favor of from what he says. You know, the options that are available. In fact, there's you can do as much. You can add ancillary uses for labs and things like that. So if they're in favor of the bill, then, you know, why not the zoning ordinance? It seems like at least perhaps it's a little more restrictive to them, but it does fit the exact use that the bill does that they say they're in favor of. So all of those things, I think, being true, I also am in favor of the zoning amendment.
Okay, thank you. Commissioner Smith.
Well, I've heard a lot of information, and not all of it seeming to be in the right direction. There seems to be a lot of conflict on what I've heard tonight. But my perspective on listening to all of that and knowing the issues here, I want to support this zoning amendment, and I'm going to ask that the hospital take advantage of this zoning to be more than what they planned. I mean, I think there's a win-win here if those other services that you want to provide are developed on the site, and that we can get more utility out of that facility in the long run. So that, I think that would be the best for this community, and so I'm supportive of this zoning amendment. Thank you.
Mr. Eggleston, thank you.
I have a couple of concerns. I'm concerned about the timing of this zoning amendment. In Sacramento, they're supposed to be listening to, this goes before the Senate Health Committee in mid-January. So I'm concerned about the timing of that and why we're doing it now and perhaps not after some discussion in Sacramento. And number two, I'm also concerned about the owner of a property who really has a property right to do with his property what he should do within certain limitations. However, on the other side, this is community health and services the community, and I'm really conflicted by that with all what I've just said, because it's so important to have, I think, an emergency room. If the hospital would say now, if Memorial Care would say now that they would in fact have an emergency room there, I would be supportive of their cause. But they haven't said that. They haven't guaranteed that they would have an emergency room there. And timing is important. I mean, if I have a heart attack, I want to go to the nearest facility before I have brain damage. And that's important to me. I think it's important to everybody. And this amendment really provides, I think, the property owner with a more generous, with a very generous types of uses that they can have, as Commissioner Wu said. They really have a lot of generous uses there that they can subscribe to. So I always say to myself, and I've said it for years when I was even on City Council and now on the Planning Commission, residents first. This really is residents first when we consider the type of care that the community here has to offer. So I'm going to be supportive of the zoning amendment.
Okay. Let me wrap this up. I share some of your concerns, Wayne, as far as timing. There's always that balance between the property rights, but then again, we have to weigh that with public safety, public health. The business I was in for 40 years, safety was paramount. And so when I went back after discussion today, I looked at the old general plan and how restrictive it was compared to what we moved to the GPAC and now what we're moving back to, not quite that far actually. The comments of Commissioner Wu where we accessory uses, laboratories, medical offices, et cetera, are all provided in this amendment, which is a very key point, along with the additional floor area ratios. Bottom line, safety takes precedent, and then what we're all about is making the findings, which I can make the findings in the general plan amendment section, the specific plan amendment sections in the zoning amendment that is presented by staff. So that's the key. That's what we're about. That's the law that we're empowered or charged with carrying out. So I will be supportive of the amendment. So with that, let's proceed with the, I think there was an amortization.
I'll go ahead. Yeah, there's one amendment to it, so.
You have something
I
else?
just had a house cleaning comment for
Okay.
legal.
House cleaning?
Housekeeping, I should
Keeping?
say, in the language on research and development. We sort of left that untied. Can we talk about that and see what you came up with?
Yes, Mr. Chairman, Commissioners, I believe the answer to that is that the definition here for R&D actually applies to this as a primary use. So if R&D, for example, at Stan Socks were being performed, that's a secondary use, something that's already permitted, that wouldn't be affected by this definition. So this deals with facilities, and if I'm wrong, Adam, you can correct me, that are specifically focused on R&D as the primary use.
Okay, sure. So we're not putting anybody else
We
in
aren't
danger. It's
affecting businesses like Stance or other similar
Okay,
businesses.
great, thanks.
But if somebody wants to come in and get a better donut, I'm all for it. But I would recommend that Planning Commission adopt resolution number PC 15061, a resolution of the Planning Commission of the City of San Clemente, California, recommending the city approve General Plan Amendment 15427, Zoning Amendment 15428, and Specific Plan Amendments 15449 to 15452. Camino de los Mares Medical Zones, a city-initiated request to amend the general plan, zoning ordinance, and zoning map to create a regional medical facility zone applied to the 6.6 acre property located at 654 Camino de los Mares, amend the community commercial zones, use and development standards, create a community commercial zone, Commercial 4 zone applied to a portion of the properties along Camino de los Mares, and add and revise multiple medical-related definitions in the applicable definitions and development standards sections of the zoning ordinance and the Forester Ranch, Rancho San Clemente, Talega, and West Pico Corridor specific plans, with the staff including an amortization clause, which I think was 1772, I think was
Code
what was mentioned.
1772 for a period of 3 years.
For a period of 3 years.
And that's with the safety valve as well, 3 years plus extensions as necessary.
As discussed,
As
correct.
necessary negotiated by the city planner or whatever.
A second.
We have a motion to approve by Crandall, second by Wu. All in favor?
Aye.
Opposed? Vote passes 7-0. With that, we'll take a 10-minute break and reconvene at 8 o'clock.
got out of Denise's party shift. That was a big one. Oh.
Call the Planning Commission back into session for the next item, which is General Plan Amendment 15-331, Housing Element Update with Amber Gregg.
Good evening, Planning Commissioners. Amber Gregg, Project Planner, here alongside with Denise Abrero, who is our Community Outreach Specialist, and Veronica Tam and Associates, who is the consultant that's working on this Housing Element Update on behalf of the City of San Clemente. So tonight you have before you our draft housing element that we have been working feverishly on since July. And what we're requesting of you tonight is your comments on this element. And then from there, we will forward your recommendation to City Council, and hopefully that'll authorize us to start the conversation with the Department of Housing and Community Development, or HCD, in order to get our housing element adopted. So with that, I'd like to introduce Veronica Tam and have her come up and give you a brief presentation. Thank you.
Good evening, and I would like to just give a very brief overview of the housing element tonight, and hopefully get your input. What the housing element is part of your general plan. It's an integral component of your overall general plan. It needs to look at the housing needs in the community, not only the current needs, but also the projected housing needs into the future. It also sets the plan in terms of objectives and goals and policies in meeting the needs of all economic segments of the community. In looking at the housing element, there is one thing that separates the housing element from the rest of the general plan, in that the housing element has to be reviewed by a state agency for compliance with state law. The agency responsible for that is the State Department of Housing and Community Development, HCD. That is the only element of the general plan that has to go to the state review, or that kind of rigorous review. When looking at the housing element, there are some key requirements in the housing element, and I'm not going to read through all the requirements, but the key phrases are underlined in here. That in the housing element, we must have adequate sites with appropriate zoning and development standards that can facilitate and encourage a variety of housing for all income levels in the community. The city also needs to, through the housing element, assist in the provision of housing for low and moderate income households, recognizing that the market would take care of primarily the upper income households. You also need to address, and where appropriate and legally possible, address or remove governmental constraints to the maintenance, improvement, and development of housing. The state recognizes that there are different types of constraints to housing development, including market and environmental constraints, but you don't have control of the market or the environment, but you do have control over the regulations that you adopt as a local jurisdiction. The other requirement relates to preserving the existing affordable housing stock, recognizing again that it's very expensive to provide affordable housing in California, and that it's more important to actually preserve what you currently have or improve what you currently have. And lastly, relates to equal opportunities for housing. Once you have provided the opportunities for housing for the in the community, you need to make sure that there's equal access to housing in your community. We're updating the housing element right now because the housing element has to have a very specific schedule for updating. There's a statutory deadline that was adopted by SB 375 that establishes that the housing element has to be adopted no later than the statutory deadline for your region. And for the SCAG region, the deadline was October 15, 2013, with a 120-day grace period. That housing element would be an 8-year housing element covering through the October 15, 2021. However, the city was at that time dealing with some zoning amendments, and because of that, the city was not able to complete the housing element on time, and having missed that particular deadline converts the city's housing element to a 4-year review cycle. That means that we are doing the housing element right now, but by 2017, you would have to do another midterm review of the housing element. And we're trying to do this as on time as possible or within the near future, because the state would like to see at least an 18-month implementation of your adopted housing element before you do a midterm review in 2017. When you update the housing element, the adoption deadline has nothing to do with compliance, and in terms of compliance with state law, the deadline is just an adoption deadline. But what on top of that is, after the adoption of the housing element, we need to send it to the state for them to certify that it complies with state law. Now, that certification would protect the city in terms of providing a legally adequate general plan, because the housing element is an integral component of your general plan. It also, in the event of a lawsuit, gives you protection that because under a state agency that has already determined that your housing element complies with state law, in the event of a lawsuit, you get more protection in that, with that certification status. It also opens up housing funds, access to housing funds, particularly those that are managed by the State Department of Housing and Community Development, HCD. Those require certification by the state in order to be eligible for those funding. Quickly, the housing elements comprised of several components: the housing needs assessment, constraints that we do look at different constraints, but you are only obligated to mitigate governmental constraints. Resources, we looked at financial resources that you have or don't have, and whether you have adequate sites to accommodate something called the regional housing needs allocation, which I'll go into a little bit more. And then lastly, a key component of the housing element is the plan that looks at the goals, policies, and programs that you will implement over the next few years. When we send the housing element to the state for review, a critical component of that review is something called the regional housing needs allocation that's been determined from the top down by the state and then coming down to SCAG and allocated to individual jurisdictions. It is not a housing production goal because you have no control over the market. You don't function as a developer. It's only a planning goal, meaning that under your land use policies, do you have the adequate capacity to accommodate your regional housing needs allocation? The RHNA is divided into income categories. Your regional housing needs allocation for the 2013 to 2021 housing element is 581 units. Again, it's not a production goal, it's only a planning goal. It's divided into income categories: very low, low, moderate, and above moderate income. And comparing your current regional housing needs allocation with your previous housing elements allocation is quite similar, but with a very minor reduction compared to the last cycle. In developing the housing element, we have to demonstrate that under your current land use policy and development standards, you do have adequate vacant and underutilized sites that can accommodate 581 units, and we are able to identify adequate sites with adequate zoning and capacity to accommodate your regional housing needs allocation without any kind of land use changes. There are a few projects that you have already approved or working on that they will get credit because the regional housing needs allocation started on January 1st, 2014. So anything that was constructed, approved, or proposed after that date would get credit. So we're able to credit a few hundred units under that, and against your 581 RENA, the rest of them we looked at the vacant and underutilized sites that you have under the current zoning and land use policy, and those are considered to be adequate to accommodate your regional housing needs allocation. In updating your housing plan, we did not do, there's one major revision to the housing plan, primarily to reflect the fact that you no longer have redevelopment as a tool to facilitate the development of affordable housing in your community. So we went through all the housing programs and policies that was supported by redevelopment and really kind of scale it back down to recognize that you don't have that ability to do that. We also take out some of the programs that are more routine function of a government that with or without the housing element, those are ongoing processes anyway. So we limit the housing element to only the programs that are essential to implement housing goals and policies, and these are the programs that we're left with, and these are the key programs that the city is ongoing operating. The one program that we added is a lot consolidation program to provide technical assistance, because a lot of the sites that we identified are very small sites and they are located, actually they're clustered together. So there is a program to look at lot consolidation to allow for more better design when you, instead of having a tiny parcel, that you have better design when you have consolidated parcels. The other program that we added regarding housing is to make sure that you continue to monitor your zoning codes and make sure that they do not unduly constrain housing development in the city. And I think lastly, we also added one program regarding at-risk housing, meaning to monitor the status of your current affordable housing and making sure that they, trying to work to preserve those affordable housing that you currently have. So with those key changes, those are that's the housing plan before you today. Just to give you a little bit of overview of what San Clemente looks like today, your population actually has been relatively stable in the last 10 years or so, not a significant increase in population, a few thousand, 5,000 between 2010, well, projected to increase between 2010 and 2020. I think there was a lot of increase in 2000 when there was a lot of construction, but then it really levels off and is projected to really level off in the future. Now, in terms of race and ethnicity, there is a little bit of change, but primarily still the majority of the population in the city is considered white, and the next big group is Hispanic. There is a small increase in amount Asians, but generally the demographics in the city in terms of race and ethnicity has been fairly stable. When we talked about, the regional housing needs allocation being have to be divided into income category. It's divided into very low income, defined as 50% of the area median income. Low income is defined as 80% of the area median income. Moderate income is up to 120%, and then anybody else is above moderate income. And it's also adjusted by household size. That just gives you kind of an idea. If you are a 4-person median income household, the income in Orange County is about $80,000 right now in 2015. And so if you look at how much people can afford, we'll show that a little later, but in terms of median income, Orange County is definitely one of the highest income counties in the SCAG region. But when it comes to housing affordability, you are the lowest compared to the other counties, because housing price in the county are much higher than on average, Los Angeles, Riverside, and even San Diego. That actually surprised me a little bit. When we look at income affordability, typically people are not supposed to spend more than 30% of their income on housing. But if you look at the income that they're making and the prices in Orange County and in particular in San Clemente, you can see that if you want to own a home, a median priced home in San Clemente, you would probably have to make $200,000 a year in order to afford a median priced home in San Clemente. But a management or engineering position would only make about half of that. So even if you have a two-income household that both of them are engineers, you can barely afford a median priced home in San Clemente. And if we look at people who are in the lower income category, the people who are in the fast food industry, in the sales, there is no way they can afford really today to buy a home in San Clemente. So what we are looking for is certainly your input on the draft housing element, anything that you would like us to reflect in the draft housing element so we can forward that to the city council and then get the authorization to send the housing element to initiate a 60-day review with the state. So this is one of the opportunities to provide public input, but we had several opportunities before. We conducted 2 community workshops. They were really, I would say they were fairly successful, and each one was attended by more than 20-something people, and we got a lot of input from the residents and organizations. So tonight we have one meeting, and in January we're having another meeting with the city council. We're hoping to initiate the 60-day review with the state, and then with the adoption in April or so in 2016, that would allow you to implement the housing element for at least 12 months before we submit the next 2017 4-year review to the state. Another thing that is ongoing in terms of outreach, just to show you a little bit, we have a bilingual housing needs survey on the city's website as ongoing. We continue to collect responses, and some of the top challenges identified by your residents are high cost of housing, and there are some neighborhoods that has physical deterioration of housing stock that needs improvement, and there is also a concern about the supply of rental housing in the community. And when we asked the residents what are the, who are the most underserved groups in the community in terms of housing, the top one is young adults. Those, probably people who are first-time home buyers who just graduated from college or who are just like getting married or they want to start a family. The young adults having homes, being able to find and afford homes in San Clemente, that could be the group. Seniors is the second group, and then disabled persons with disabilities are the second group. So that concludes my presentation. I'll be happy to answer any question you may have.
Yeah, I have a question. I went to one of your public outreach meetings. It was very well done, and
Thank you.
putting the stickers on the various maps, which is contained, I think, in the
Introduction.
part of the appendix. In your professional opinion, what do you think our RENA status is today as far as where we're at? Are we in a healthy condition, or is it attainable? That's one of the key drivers, and that's one.
I think you're certainly well on your way. If you look at this one slide, there are a couple of projects that the Cottons Point, and Avenida Serra. Those 2 projects are affordable projects, and you are about 93 units into your regional housing needs allocation of 229 for the lower income. So you're almost you're more than a third of the way into your lower income arena, and that honestly is a major achievement. Most cities throughout the 8-year cycle would not have achieved that. And being able to achieve that in the first few years of your RENA cycle, that's definitely a major achievement. I think overall your site's inventory should be pretty healthy. Of course, the state can say anything, so
As long as it took to get the last one approved.
Right, so
I agree with you.
Yeah.
Mr. Eggleston, you had a question.
Yes, I have three questions.
Sure.
Number one, in 2015, we've issued just as many vacation rental permits as we have in the previous 3 years. So now we have around 400 vacation rentals. How does this affect our housing stock?
It has, well, vacation rentals obviously has a potential impact of taking the housing stock that could be permanent rental and turning into a temporary rental that doesn't benefit your residents. So I think that is something that you may want to consider. But the state doesn't have a position on that. So it's entirely a local jurisdiction's decision.
So that would not be in the housing element?
No.
Okay. Question number two. What is the median rent here in San Clemente? I tried to find that in here, but
It's in here.
Because I
Yeah,
read that before.
it's in there, and
Yeah, it was in the brief.
you're faster than I am now.
I remember from reading it.
Okay.
Oh, wow.
$72,000 in the rent. It's in the brief.
No, the actual rent.
Monthly? No, the
The
monthly.
actual monthly rent. I thought I read that in here, and I
Right.
can't find it right now.
Well, what we did was we looked at some of the rent listing we were able to find in, can you find it? Just 1,800, she said.
1,800. And is that for a two-bedroom or for a three-bedroom? She'll find. And my third question is, that she'll be looking up also.
Right.
Is the median single-family homes here in San Clemente?
It will be in the same section, so she will be able to find it.
I'm just trying to find it because I remember reading it before in here and commenting upon it in my own mind, but I can't find it now.
Right. Unfortunately, I'm so used to having an electronic copy now. Now I wish I have one that I can flip through.
Well,
it's true. In your third, all your questions are in process here? Okay.
Yeah. So she's fine.
Okay, well, she's looking on to Commissioner Rockwell.
Just notice here, are we going to treat this as our study session?
No, this is not a study session.
Okay.
You are in session.
We have a study session identified here on the second page of this packet that we received, and I don't recall attending the study session. So it could be a mistake, maybe it's just meant to be planning commission meeting, but if there is going to be a study session,
what page are you
on? Would be on HE4 of the housing element.
And I think initially I was intending this to be a study session, but the city decided that it would work better as a public hearing. So either way, this particular meeting is not required under state law because we're not adopting the housing element yet, and we will be conducting more meetings in the future. And to answer your question, Commissioner, page housing element HE19 would have the average rent by unit size based on, just whatever we can find on Craigslist and over a 2-month period.
Page 19.
Page 19, HE-19, table 23.
That's where I'm missing that page. But I do remember reading it before.
They're double-sided.
I know. But it's not here.
Oh.
Well,
you are missing it.
Lost page control again?
Well, they weren't stapled. We received them.
Okay, I'm fine. We got it. Yeah, $1,875 for 3-bedroom.
Right.
Okay.
And if you look at the median price home back in 2015, it's $825,000.
Okay. I remember reading this before, but I somehow lost the page because I read this about a week and a half or so ago. I'm a real estate appraiser, residential. Okay. So in San Clemente, I always look each week at the Orange County Register because they have the 2 zip codes in there.
Mhm.
And they are averaging about 780, 785 for both zip codes. And so, and then I took a look, I bet I have it here. And then I took a look, yeah, I did, right here. I took a look at San Clemente. Now, do you take this from like a certain month in 2014 to the same month in 2015?
Yeah, we use the DQ
Yeah.
News. That's why it's,
Yeah.
well, I think the general conclusion I think you and I would probably still come back to is not a typically affordable price.
Right, no, I realize that, but
Yeah.
I took a, from the SoCal MLS.
Right.
And my figures from 2014 to 2015, not
Mhm.
month, not a particular month, but for the whole year, year end to year end.
Right.
And I took the year end for November of 2015.
If you can provide that data for us, we
I will.
were happy to update. DQ News, as you probably noticed, that they recently sold to Core Logic and no longer provides the information to the public
right.
for
And it's-
free.
Yeah, exactly,
And
okay.
so
Right.
that's the only piece of information that they do still provide for
Right.
free. So since
And-
you have that access, I will appreciate
Right, I
that
will do that.
information.
And in 2014, believe it or not, the median price in San Clemente was $855. The median price in 2015, up through November, was $890.
So it's actually gone down.
No.
No, no.
855 to 890.
No, it went up.
You just have
Oh, when?
conflicting information, so you have a lower, your
Oh,
numbers
okay.
are
Okay.
lower.
Yeah, your numbers are lower.
But
So I thought that was interesting, and I'll give you this information
Yeah.
that I have.
We definitely appreciate that because when we don't have access to the level of information that you
Right,
do.
and I'll be happy to do that, but it seems, either figure seems very high.
Right.
To say the least.
Okay.
The rents here that you have seem also low. And so I wanted to, I'd be able to give you some information on that too, but your rents seem awfully low also.
Okay.
I just did I had an appraisal in central San Clemente, and I had to do a rental survey for the 1, 2, and 3 bedrooms in central San Clemente. And your rents are very, very low.
Okay.
that you
Yeah,
have.
we appreciate that
Yeah.
Typically, when we only have access to certain types of sources.
Right.
And Craigslist are usually people who put it up for smaller complexes.
Uh-huh.
Larger complexes, they don't. And then people who are renting their homes don't usually
Right.
put that up as
Now,
well. so.
this comes from SoCal MLS.
Okay, that would
Yeah.
be,
Yeah.
we appreciate that.
Okay.
Thank you very much. Commissioner Black.
Oh, I'm sorry, my question was answered.
Okay. Mr. Rulon.
Yeah, hi. I got the impression, and if my impression is wrong, let me know, but most of the programs and places that you identified for low-income housing or more density are west of the 5, mostly, I think, between, Pico and Presidio, roughly that area.
It's mostly where you zoned at least 24 units to the acre, because the state basically says that if you provide sites that are at higher density, it's more likely that they can be financially feasible to develop affordable housing compared to lower density sites. And so what we have to show in the housing element is where the higher density vacant and underutilized sites are located, and that's where they are right
So
now.
according to the states, these are just good candidates for
Correct.
for doing that.
Yeah,
sort
it
of-
doesn't restrict affordable housing to those areas. If you have, somebody who wants to donate their land, and, somewhere else, it could be lower density and still be affordable, that obviously doesn't happen very often, but when it comes to feasibility, the state looks at density. And so that's what we are looking at under your current land use policies, where the higher density zoning is located.
So would the state be more amenable to our housing element if we took other areas and gave them a higher density? Maybe areas that are currently zoned as low density and made them medium density, something like that?
And I'm going to quote the state on this one, that in general, they do not interfere with local land use policies. As long as you have adequate sites to accommodate your regional housing needs allocation, it's not the state's it's not within their purview to tell you where it should be located. I think that is something that, as the Planning Commission and City Council, that you may want to consider is what makes sense in your community. As long as you are able to provide the adequate sites, that's feasible sites, that they're not sites that just recently has a new shopping mall developed on it, then the state would accept the sites and they would not try to influence you in terms of where they should be located.
Okay, and so it's fair to say right now that the areas that you've identified here right now are things that, in your opinion, the state would be content with in terms of us meeting all of our obligations?
At least half of the sites are sites that they had accepted before but haven't been built on since the last housing element, because it was available but it didn't get built on. So because it continues to be available, we are including them. There were some sites that no longer are no longer available, so we added some sites, but not changing policy, just identify additional locations where high-density zoning is located.
It was a Pacific Life Church kind of hurt us a little bit.
Correct. So, half of them were sites that you used before under your current housing element.
Okay, good, thank you.
Commissioner Crandall?
Yeah, she's kind of gotten to where I was going. For those of us that have been on the commission long enough and went through the last cycle, there really hasn't been much change.
Correct. In terms of the sites, yeah.
I want everybody to realize that it was only 2.5 years ago? 3 years ago? When did we do the last housing element?
2013 is when it expired.
2013. Well, it expired, but we just got it approved, and this particular exercise is only going to be in effect for about a year. Is that correct?
Yeah, and then we're going to turn it around and then
Do it again.
modify this and then do it again.
And in that cycle, I don't know if we have to dwell on this thing as much as you might think, because she's going to be changing everything, and we're going through the same process again in less than a year. And the one question I do have is, do we have to show progress for your next cycle?
Yes.
So we're going to have to implement something in that
Correct.
one-year process.
And yes, and my original proposal to the state is, let me just get this over with and do one and then turn it around, do another one and just get it done, and then you'll be good for 8 years. They didn't like that. And so they requested that at least 12 to 18 months of time for implementing this housing element once it's adopted, to show progress before we adopt a new one.
So you think we have something there that we can do?
Yes, and that's the reason why we, in updating the housing plan, I took out a lot of things that I don't think you can do anymore because you don't have redevelopment funds. And so I took...
Getting this certified gets us the funds back again, so that's one of the...
Well, not the redevelopment funds.
Yeah, that's true.
So.
Well, I was kind of alluding to the process that Jim's going through with our zoning code updates and all. Would it be prudent in some of them to let them lag a little bit so they fall in the cycle that would get this approved for the next cycle? Go for it, Amber.
Yeah, I think we got it.
We already have a couple things teed up within that 18-month time period that need to be done, so we are very cognizant of that.
We're teed up. Very good. Because we have other time limits on getting the zoning ordinance updated, so.
And that's based on the previous housing element, which is very similar to this.
Just
or
the general plan
close
drives
identical.
the windows for our zoning ordinance, too. Mr. Wood.
Yes, Mrs. Tam. You say that the most underserved population in the city are disabled persons, senior people, and young people.
It's based on, it's not, well, that is very typical in most communities, especially in a high-cost community. But this is the outreach survey that we did, and the results that came back, what residents felt.
Well, I don't question that.
Yeah.
My question is, What is your recommendation on the policy and action items to make some progress on this?
Well, I think you do have the inclusionary housing program, which allows you to provide affordable housing for particularly young adults and perhaps some seniors. And we do have some zoning code amendments, or the city has recently done some zoning code amendments that would benefit persons with disability. But I think overall, the answer to that question, even though it's the answer to almost all housing element questions, is more affordable housing. And you have a good policy with the inclusionary housing program that a lot of communities are struggling with. Without redevelopment funds, that is one of your key areas. But the next question is, whether you want to encourage more senior housing to be built in the community. That's one thing that a lot of communities are finding in high-cost areas, that they are not able to scale down or step down from their traditional homes into other kind of opportunities. So that's something that you may want to consider in the future.
Well, according to our presentation, we're doing okay on affordable housing. But on the whole spectrum of a continuum of care, it appears that the emergency sheltering and the transitional housing are much needed. But on any development in the city, sometimes we ask them to make some concession to provide affordable housing. Sometimes they pay in lieu fee. Do we have similar mechanism to generate some fund for transitional housing and emergency shelter?
Currently, you don't, and for emergency shelters, the way the state law works is emergency shelter for the homeless, and it has to be a year-round permanent shelter. That typically takes a lot of funding that I think usually a local jurisdiction through an inclusionary program would have a difficulty sustaining. So that's something that I think it's a little bit more difficult to do. Transitional housings, I think it's, again, a local policy whether you want to take a look at it. It's not very often done by other jurisdictions because typically those housing has to be partnered with a nonprofit. It's not something that a private developer, market rate developer would have the experience and qualification to do. So that's, unless you're able to generate an in lieu fee that can be given to a nonprofit, otherwise it would be very hard to go to require that as part of your inclusionary.
Thank you.
Okay. Yeah, there's some other issues, like the one reason we couldn't get this thing renewed is we didn't have SB2 ordinance in place.
Exactly.
So we do have that now, so the state should be somewhat accommodating by submitting now. Is there any other, let's see, you have another question?
Yes. Hi, Ms. Tam. Thank you for preparing this report. Very comprehensive, well put together. One thing I didn't see in here, and I may have overlooked it, was discussion of trends in what's happening in housing now. And one example might be what the ranch is doing, 14,000 dwelling units, and they have a certain focus, certain demographic that they're focusing with their development. And I think it's weighted towards retired age citizens, and how those trends in housing, especially in Southern California, could be reflected in a report like this and recommendations made on that, so that we can sort of address that need, that demographic more effectively.
Okay.
What are your thoughts on that?
Well, I think we can definitely go back and take a look at it, and from what I'm understanding you're saying is that the current development is more leaning towards constructing housing for the more aging and more financially well-equipped population compared to the younger adults. Is that what you're...
Well, specifically, I'm thinking what trends. What are the current trends in housing, specifically new construction?
Oh, okay. Not necessarily in the city right now, but in California, what type of things are happening?
Right. I'm assuming that look at reports from ULI,
Right.
Trends in Real Estate is one,
Mhm.
where there's certain demographics identified in how housing is shifting and where the focus is.
Mhm.
Is the footprint smaller? Is the
Right.
demographic increasing in a certain area? And how those trends could be applicable here in San Clemente and what we're doing in terms of recommendations. We're not building necessarily, a lot of new homes here
Mhm.
like we once did, but we still have an important area to focus on,
Right.
and I didn't see anything like that in this report.
We can certainly add on to it. The current trend is obviously smaller units, more urban type of environment, and also more services within the development that are encouraging the young population to stay within the community because they look for certain types of amenities within the multifamily type of structure. There are certainly also trends of multi-generation living, but your population is not as Asian-oriented. And I can tell you in more Asian-oriented communities, the kind of building trends are very different than yours. And the type of units that they're building are different. They're more into the they're not less into like granny flats and second unit home, but double master suites because the grandparents has to be in one of the master suites, and that's culturally unacceptable to not put your grandparents in a master suite. So that kind of styling is a little different, but we can certainly research a little bit more on that and reflect more in the housing element.
Thank you.
Okay. Yeah. To kind of clarify things, I think the housing element is constrained and bound by our city limits. So like you mentioned, the ranch plan, which is beyond our purview right now, we don't include that, and I don't think we're allowed to.
Yeah, no, you can only include things that are currently
That's right.
within your city limit.
Even though potentially that one site could potentially be in our sphere of influence, it's not. So for this cycle, we have what we have, and so at any rate, let's continue. You have another question, or you want?
No, I just wanted to clarify that I just thought it was the current trends could be applicable to what's happening in the city of San Clemente.
Mhm.
We've got certain demographics here that are defined, and how housing and that demographic can mesh together so we can come up with a plan that can work for those folks that have specific needs. So it's addressed to some degree in here, but there's no discussion of trends and recommendations to address those potential situations. Thank you.
Any other questions?
Yes.
Yes, a quick question to our city planner. Right now, because we don't have that housing element certified by the state, so we don't have the access to some state funds, or does it also affect our federal fund, like HUD funds? If we get this one adopted, what is the fiscal impact to the city? And how much extra fund we will have access to?
It has no effect on Veronica.
Yeah, I can comment on that. Yeah, no, not in terms of federal funds. You are your own entitlement jurisdiction. You receive your funding from HUD regardless because it's an entitlement jurisdiction. So the only funds that you would be missing out on would be the funds that are under state HCD administration. But it's not possible to tell you how much funding you're missing out on because the only thing is you're not eligible to apply for competitive grants. So it's the eligibility, but there's no guarantee that you will win the funding even if you are certified housing element. So, or some of the fundings would be appropriate for you, but you're missing out the opportunity to apply.
You can't enter the game without
Right.
a pre-element.
Thank you.
Are there any other questions of Ms. Tam? If not, well, we can't see that. Okay, one more time on data here.
Yes, I
forever.
wanted to.
Can we shorten it?
I wanted to give you the information for SoCal MLS, and I did it before for the 12 months and 12 months for 2014, 2015.
Great.
But what I'm going to give you is from July 2014 and July of 2015.
Okay.
And it shows the difference. I want to give you the averages, which I don't use as an appraiser.
Right.
We use medians.
Medians, right.
Yes. So take a look at this as far as the single family for medians. I also did for condos for the same time period. So you can take a look at that. And also, I'm going to send you some information with regard to the rents. And I did not take my information from Craigslist. It's hard to take it from Craigslist, but it's more important, I think, to take it from SoCal MLS. And the one-bedrooms from, you had $1,000, a little over $1,000 for one-bedrooms. From SoCal, it was $1,575. For two-bedrooms, you had around $1,200. It's actually $2,300 for two-bedrooms here in San Clemente. For three bedrooms, you had $1,875. It's actually $2,900. I did not do it for four bedrooms.
Okay.
So it's really a much different source, and it's even more difficult. It's even as difficult to do it with SoCal MLS because not everybody advertises in SoCal MLS, as they don't always advertise in Craigslist. Sometimes they put a sign out. So I know how difficult it is to get these statistics for rent.
Thank you.
I appreciate that. Thanks.
Okay, any other questions from, with that, we'll close the staff hearing. Open the public hearing. Is there any cards, Secretary? There are no cards. We'll close the public hearing and go into discussion. What I'd like to do, this housing element is very well written. It follows the previous one. I think it's in a format that the state ACD expects, so I think it's quite well done. There might be a few iterations here and there. Thank you, Mr. Eggleston, for all your data research.
Yes.
The numbers will probably not help us, but in the long run when they put them in there. I'm going to go through kind of a chapter review very quickly. I think it's, we don't want to belabor the point. Let's be effective and efficient going through this. And so if you have any comments or questions in the introduction or section 1, do you at all? If not, we'll move on to section 2. The needs assessment, I think it's fairly well.
I have a comment on section 2 on page HE-24 on the table 29. There are some little errors on the tally. If you look at the number 6,663 and 75%, that appears to be an error.
Yeah.
That's correct. That's an error, and that's in our edits. I apologize for that. And I believe there's also an error in Table 31 that we're aware of that we're modifying too. But thank you for pointing that out.
You're welcome.
Yeah. Yeah, in fact, there's some areas where it's not referred to. That Amber and I had a discussion on that yesterday, but thank you for reinforcing it. Good. Going on, the rest of housing element section 2, any other comments from staff from the commission? If we're happy with element 2, let's move on to element 3. Mr. Ruin?
Yes, I had a question about section 318, page HE55. It talks about the growth management initiative, but that was, it expired December 31st, 2006, and was not extended. I'm just wondering why we're including that description of a program that expired so long ago, what the function of that was, or if it was necessary. HE55, the very top, section 318, that one paragraph in 318.
We can certainly take that out. The only thing that we're a little concerned about is that the state is so used to looking at this one, they may question us whether that, whether the growth management ordinance has been extended or not. But I agree, it can be taken out, yeah.
Yeah, that's fine. If the state is looking for that and it'll show up as missing for them, I have no problem with it saying,
that's the only reason why I was like, I kind of ponder on that myself and kind of decided, you know.
Yeah. I was just asked because it ended 10 years ago, so I was wondering what it had to do with it. But yeah, let's let the state.
Does the city planner have a reason why we let it expire, or was that too long to debate? Nothing. Don't worry about it.
It's a long story, but
We don't
basically,
want long stories here.
it
We
was
have-
500 units a year, the limitation.
That's
We
the
haven't
problem.
had 500 units in this town for
That's why the
a
point I was
decade or
trying to
more,
bring
so.
up. I saw the 500 years of there, and even at the Talega max build-out rate, we weren't doing 500 homes a year, I don't think. Yeah, okay. If there's nothing else on Section 3, Housing Resources, Section 4, we do have the issue on Salinas, I think we got that correct.
Oh, you got that?
Yeah. This is key because we've got to make, that's where your inventory and everything else we had in. I do, there was one listing, we had Habitat for Humanity came in and looked at Rosa, Avenida Rosa, just south of the senior center, and then the neighborhood kind of got a little vocal about it. But now the senior center is open, that traffic, the parking issues there, but Rosa might be some area we could consider before. It's not on our list now, but I would suggest maybe you relook at that. Yeah, we were here when the neighborhood came in, but the senior center hadn't opened yet. And if you look back at it now, it's pretty well self-parked. I've been watching it myself personally, and so I think that might be those are 3 or 4 lots there that Habitat for Humanity was interested in that we might want to consider putting on the list, or approaching the owner, I think, or whatever we need to do to conclude that might be it. And it's right next to downtown for workforce housing, which I think would go well. It's the only comment I have on Section 4. Anything else on Section 4? Going onward to the key, I think, is Section 5, which is the action plans. And does the council, or commission, I should say, have any questions or any issues with Section 5? Okay. I think it's a very good plan. I have my old one. I kind of did a page flip turn, and I think I compliment you on a very well put together plan, and with the team you've got there. And of course, our staff member, as they say, we gathered up all the usual suspects, and they're good. So with that, if there's any other discussion?
If there was no other discussion, I was going to make a motion.
Well, why don't we do that?
Then I will move that we adopt resolution number PC 15-063, a resolution of the Planning Commission of the City of San Clemente, California, recommending that the City Council consider the draft housing element for 2013 to 2017 for submittal to the State Department of Housing and Community Development for its initial review.
I have a motion. Do I have a second? Second by Mr. Smith. All in favor? Aye. Opposed? Passes 7-0. On to, good job, and we'll hope to see you again as we go through the second iteration of this soon. With that, we'll go on to item D tonight, zoning amendment 15225, sign exception permit and sign ordinance amendments with Mr. Nicholas.
Yes, good evening, Planning
Family tag
Commissioners.
team.
Sean Nicholas, Project Planner. This is the sign exception permit and sign ordinance amendments that were originally initiated by the City Council. Our goal this evening is to summarize the proposed recommendations from staff based on all of our previous meetings, then hopefully at the end of the evening get a recommendation to City Council. Let's begin by again addressing the 3 topics that were brought up at City Council: removal of the freeway-oriented signs, address issues related to the size of signs larger than 64 square feet, and also codify past practice regarding modifications to non-conforming freeway-oriented pole signs. So jumping right in to address freeway signs as a whole, the first change that staff has recommended this evening to Commission is the removal of the sign exception permit process. That will remove, and also making a change to prohibit all freeway-oriented signs in the sign table listed there at 1784030. Also, staff is recommending to add provisions for freeway visible signs into the code that will be added into the aforementioned table, and require discretionary sign permit to go through the process to receive approval for those types of signs, new types of signs of that type. Associated with oversized signs, with the removal of the sign exception permit process, that will also remove the ability for signs larger than 64 square feet to be established moving forward in the community. Those signs within signs with larger than 64 square feet that are components of a master sign program would be allowed to continue. I gave an example in your staff report is, for example, if Walmart decided to leave, or I put up the Sports Authority, in Steinmart, if Sports Authority were to leave and Bed Bath & Beyond would want to come in, as long as they were within those provisions and they could retail like-for-like use, they would be able to come in and have a sign larger than 64 square feet, consistent with the dimensions as approved by City Council. Lastly, associated with freeway-oriented pole signs, with the removal again of the sign exception permit, and as well as the change to the sign table, these would be considered non-conforming. We've also added some additional language to the sign ordinance regarding removal of signs, section 1784.020H10 there, which has to do with change of use. So really, as council requested, codifying the practice of the community over the last 20 years, working together with city attorney, we felt this was the most simple way and straightforward way to address that. Also, the goals with this, we had a public outreach talking to many business owners who have freeway-oriented signs in the community, and one of the things that we heard was uncertainty about when they can improve their in terms of maintaining their signs. There was even a concern expressed that even just changing out the lights, that would concerns of not knowing if that would be the threshold the city would require it to bring it down. So one of the goals of this is to make it really clear that even though they are considered to be if approved by commission, recommended to commission and approved by council, while they would be non-conforming, they would be allowed to maintain their signs. It's just that the thresholds is set forth. That's when they would need to be removed, is the change of use, so on and so forth. So we've tried to make it clear so those that have the signs, they would promote them to take care of their signs and keep them in good working order and good working fashion.
Or update technology to be more energy efficient, et cetera.
Things of that nature, yes, sir, absolutely. Also, part of the discussions we've had over the last few months with Planning Commission, we've discussed the idea of amortization. And so, provided to you this evening, staff has provided some language in Exhibit 1 in the attached resolution associated with an amortization process. In general, though, as discussed in the staff report, there's generally 3 options in front of Planning Commission. Very briefly, those are Planning Commission can decide that they want no amortization process, recommend no amortization process after all. They can recommend an amortization process with no grace period, and they can recommend an amortization process with a grace period. And all of those various scenarios were spelled out in the staff report, and we can discuss it here. That's probably one of the biggest issues in terms of discussion points to maybe get a firm recommendation of what does Commission want to recommend to City Council this evening. Just so you know, and as I noted in the staff report, the Exhibit 1 in the resolution does include the amortization language, and the way we have written it is it does include, as it says in option 3, a 10-year grace period. And the intent there was from 10 years grace period from the adoption of the ordinance. I believe it says January 1st, 2025. So depending again on the direction from Commission and ultimately direction from Council, we would, if it were to move forward, we would modify that I believe it's Section F of the new portion of the code accordingly. Also, just associated with this, there was some federal cases that came down associated with temporary signs, in particular political signs, and that regulating temporary political signs was seen as being unconstitutional. So we've provided some additional languages just to update that in our code to bring it in conformance with that recent Supreme Court decision. And with that, staff does recommend the Planning Commission discuss this evening and ultimately make a recommendation to City Council regarding all of these code amendments, and staff is available should the Commission have any additional questions this evening.
Start with Commissioner Eggleston on the right. Question of staff.
Thank you. Actually, this is a question for the attorneys. We now have a substantial new development in town, the San Clemente Outlets. They have submitted plans for signs here in San Clemente. How would this zoning amendment 15-225 affect them?
Mr. Chair, Commissioners, in short, it will not affect them. They have a development agreement which vests their rights to the zoning ordinance in place when that was approved and became effective, which certainly predates this amendment if it were approved. So again, this would not apply to them.
Thank you.
And to acknowledge, we are in receipt of a letter from Craig Realty and also from Mr. Brad Malamud on this issue that was shared with all the commissioners electronically. It could be entered into the record. Commissioner Rulon, you have a question?
Yeah, I was just wondering what the reasoning was for the 10-year grace period as opposed to 1 year or 20 years.
We tried to pick a number that we felt, I believe I wrote in the staff report, that a period of time in which it would give those who utilize freeway-oriented signs process to continue to use the signs for an extended period still moving forward. Also would allow for them to explore other ways in which that they can advertise their business and let potential customers know of their existence and what other options there are out there. And then lastly, the probably most complicated portion of it, which has to do with the depreciation of signs, of course, associated with the IRS tables, which are extremely clear and clean cut. It allows additional more time for the depreciation of the signs associated. The longer they go for, the more useful life that the businesses have been able to get out of those signs. So that was kind of the thought process. Now, as I said in the staff report, we just chose 10 because we thought it was a decent amount of time to allow for those things to happen. As I try to say, it could be, as you say, 1 year, it could be 5 years, you could have 0 years. It could be 15 years, 20 years. And I think that there's potential arguments on all sides, and ultimately it is up to commission, and we will take that recommendation accordingly to council.
And this is a grace period that starts after the signs have been fully amortized?
No, what we're recommending is that it would take a grace period would start whatever number of years following adoption of the ordinance. So if you were to make a recommendation this evening, we are tentatively looking to go to the second meeting in January to City Council, and then if they were to take an action that evening, second reading, 30 days from there, we're probably looking at, quick math, sometime in March 2016. If we were to go forward with the 10-year, if council also, it would be March, this date, March 2026. And then at that point, the notification associated with amortization, having to take down the signs, that's when that whole process would begin. Does that help?
Oh, so after 10 years, then we start the amortization?
Yes,
No,
sir.
after 10 years, you start removing the sign.
Yeah, you start removing, but that's the amortization is the removal, so that's all part of it.
Oh, I was thinking of the amortization as it was when you start depreciation based on the tax code.
In tax code, the way the tax code is written, and please, Mr. City Attorney, jump in if I'm saying anything incorrect, but the way that the amortization code reads in state law is from when the sign is installed. And that's why I made reference that typically most signs based on the federal IRS tax tables depreciate in between a 15 to 20 year period depending on how they're claimed by the business owners, so on and so forth. So technically after that 15 to 20 year period, that's when arguably the legal and useful life of the sign has reached. So that's why I said generally if the amortization process were to be approved by City Council with no grace period, technically any sign that is over 20 years, arguably could be made that the useful and legal life had been, has done. Now, there's a whole process associated with that, and I tried to make that clear in the staff report is no matter what process you choose this evening, there are potential processes that we'll have to go through. There's potential implications moving forward for the city, financially, legally, a number of things that we would have to work for, and that would be kind of assessed on a case-by-case basis as they come up.
But if it's been fully depreciated based on the tax schedules, there's no cost to the city, correct? It's only a cost if... No,
Mr. Chairman,
good. Let's hear about
Commissioners,
that.
I'll chime in right there. The California Code entitles the owner of any sign that is amortized fair and just compensation for that sign. That code does not specifically reference the IRS IRS tax codes, the depreciation schedules. Now, generally, when amortization periods are provided for in a zoning ordinance, that's what you look for to determine how long an asset takes to depreciate. But when something is amortized, it really is a question of fact as to whether or not it has fully depreciated. So even if a sign is 20, 25 years old and the council decides to amortize that sign, there still could be a question of fact and a dispute of fact regarding fair and just compensation, which is taken up initially pursuant to this ordinance at staff level and then potentially in the courts. So 15, 20 years is certainly no silver bullet, neither is the grace period. One reason for that grace period is to ensure a longer period for the usable life, the useful life for those signs to pass, thereby reducing the potential exposure of the city in the event that amortization is chosen.
Okay, good. So that depreciation schedule informs the discussion, but it's not the end of the...
Very well put.
Okay.
Basically, when the ordinance goes into effect, you start the depreciation, even though the sign might have been there 20 years already. It starts at time zero at that time?
No, Mr. Chairman, but depreciation begins the minute that the sign or any improvement to a business is put in place. So, for example, there's case law on amortization in California that deals with the plumbing business, right? And a 5-year amortization schedule there based on the fixtures that they installed. Now, that amortization, the depreciation, I should say, of those fixtures began the minute they were installed. And so the question is, how long is enough to fully depreciate from the date of installation? So if a sign has been in place for 40 years, the question is that long enough for the full useful life to have run? And that's a question of fact. Again, the IRS depreciation schedules inform the analysis, but aren't dispositive of the analysis.
Thank you. Very, very good description. Mr. Black.
Yes. Hey, Sean. Okay, so could you get into the maintenance piece of this ordinance and describe those thresholds of acceptability? So at what point does it tip? So if a tower is structurally failing, it needs to be replaced or supported structurally, so much so that there is a significant change to the character of that structure, would that be considered maintenance?
It's a tough question to answer. I would clearly maintenance is something that's required in the code, both in the sign portion and as well as other portions of our municipal code in general associated with maintenance of properties and so on and so forth. I would say the best way to answer that question is it would be an evaluation, I would say, of a case-by-case basis. We try to be consistent, obviously, with all things. I think that, there are provisions in the code already, 1 through 9, in the removal of signs that you see in the sign ordinance, and there's provisions there. We obviously have the provisions that we have. Of course, this is not a removal of use because that's a new thing, but we have the 1 through 9 in terms of types of materials and, when we move signs, when you take a sign down to fix it. So I think that we would do anything we can to promote and work with people to maximize maintenance and make sure that our signs are functioning appropriately and properly, and we'll work with them to do so. And I think probably the city planner looks like he might want to contribute to that discussion.
Our desire is, while the signs are up, to be functional and aesthetically pleasing and in the condition they're supposed to be in. So that's where our maintenance standards would lead. Your question regarding if there's a structural issue that requires the rebuild of the sign, if that were the case, then it would be probably a removal of the sign.
Mr. Chair, Commissioners, if I can chime in as well, it takes 3, I guess, to yes. So to add on to what Jim said, the provisions of section 17.84.020H would actually govern an instance where maintenance really entered into the realm of replacement, right? And that's where the 50% threshold will come into play. That, or if the sign is a danger to property. I've actually seen this issue arise in other jurisdictions with very similar codes, where when the maintenance is to repair what is essentially a damaged sign, damaged over half of its use, then you get to the point of removal. But until you get to that point, then any maintenance is permitted pursuant to the code.
There's another leg to this, and that is with maintenance, say it's lighting or replacing the screen, if you will. Maybe it says ARCO on it. There's going to be potentially a building permit application, correct? And with that building permit application, we find that tower was built in 2070 and does not meet current code, and as such is failing. So by failing, it automatically becomes a potential danger to human beings. If that tower does not meet certain structural standards now, it is in fact dangerous. So
that's part of the maintenance code that's in effect, I think, right now.
Right. So if that is the case and does require replacement or significant change, then that 50% threshold would be exceeded and required to be removed and replaced or removed. Thank you.
There are no easy answers when it comes to science. There's no easy answers.
Mr. Wu.
Yes, Sean. Do we consider those oversized and freeway-oriented signs or post signs, do we consider them public nuisance?
It's permitted, right? No. Do we consider them a nuisance, I think is the question?
Right.
Mr. Chair, Commissioners, is the question, do we now consider them, or if this were adopted, would we consider them a public nuisance? And I can answer both those questions. The answer is now they're permitted, so therefore not a nuisance. To the first question, to the second question, if this were adopted as proposed, certain signs would become non-conforming, which is a legal status, but they would not be a public nuisance. Now, if they were destroyed or a danger to the public, which is a different question altogether, then they could be a nuisance. But simply by their existence as a legal non-conforming use, they're actually a legal use, just non-conforming with the current code if this were adopted.
Thank you.
Okay, so, and in the current ordinances we do have, they're allowed to maintain, repair, update, et cetera, at current, right?
Yes, sir.
I know some owners are worried of that, so they could go to pin lighting or more energy efficient lighting or whatever Denny's needs to get the basic bulbs they have working or whatever.
Yes, sir. And like I said, one of the goals, and I state this throughout the staff report, is to make it clear what threshold would that happen to promote maintenance and to work with our business owners to do that.
Another question, let's say the owner owns a structure, the structure itself, not the sign, and he needs to make some necessary improvements to the structure, safety code issues, or just to make things more energy efficient because we have other plans in place like that. What threshold there triggers maybe the sign comes under review? In other words, we have certain improvements by certain facilities here in town, and we've triggered the ordinance to remove the sign, but maybe there's a minor correction needed to the building or an upgrade that makes it, his business, cost of business cheaper. Is there a threshold there, or is it something in our current ordinance that allows him to come in with a minor building permit request without triggering the sign removal?
Are we talking about like the business building? We're talking about a sign structure, right?
We're talking about a business that has a pole sign.
Okay.
And a lot of them are worried about even improving their basic buildings, right?
Okay, so you're talking about the buildings, not the pole sign.
I said the building.
Okay.
Now, let me repeat it. Okay. And so let's say they just want to change out the air conditioning, electrical power system for energy efficiency.
Yeah.
Can they do that without being in jeopardy of their pole sign being
Yes, sir. The key threshold is the change of use. So yes, they could paint, facade,
put a solar array on the top of the roof,
solar array, as long as there's
whatever.
no change of use.
Mm-hmm. Okay. Thank you.
You're welcome.
Any other questions, Mr. Eggleston?
Yeah, I have a question with regard to the political signs, and this came up during the last election here. It says the sign must be located a minimum of 3 feet behind the sidewalk. So, there are a number of instances where the buildings may come up to, within 2 feet or something of the sidewalk. Therefore, a political sign cannot be placed in that area. This came up last time, and it was a source of contention with regard to a number of candidates.
I would actually defer, because that language came, and I believe it came out of the results of the hearing, so I would defer to the city attorney on the recommendation regarding that particular language, sir.
Okay.
Mr. Chair, Planning Commissioners, first and foremost, the regulations proposed apply simply to all temporary signs across the board, not just to political signs. The distancing requirements do not come from case law. That is simply a policy considerations. The Planning Commission can recommend anything they would like as to placement of temporary signs. The important issue that arose from the Reed versus Town of Gilbert case is that specific regulation of campaign signs, non-commercial signs like religious signs, church carnivals, etc., is a content-based regulation, which is unconstitutional. So we have to regulate all temporary signs the same. Again, distancing requirements, where they're placed in the right-of-way or on private property, that's a policy consideration for the commission to make.
I think, Sean, you covered quite a bit there.
And snipe signs means temporary signs are fastened fences and so forth. These would be prohibited. They cannot fasten to fences, trees, utility poles, and other structures or fixtures. Is that correct? That would be temporary signs and political signs.
I believe, yes. Anything that's a temporary sign is what this is involved with, yes, sir.
Okay, so
if you lose your cat, you can't put the sign on the telephone pole, Commissioner Eccles.
Well, a lot of people do. Okay. So it's going to be important for our code enforcement department then to be consistent with political signs and temporary signs. And that's important to do because sometimes that's not always consistent. So, okay, thank you.
We will work closely with them.
Just,
Absolutely.
excuse me, I'll recognize you. Do you need to talk? Yeah, go ahead.
Did you say that these temporary signs would not be allowed to be put on a chain link fence? Is that right? Is that what you said?
I believe that's what the intent is here, yes.
Yes.
So that's a big change.
I don't think so. I think that's prohibited now.
Banners, I can tell you that, we deal with, probably the most common temporary sign that planning deals with is our temporary banner signs, and those are required to be on walls, on building walls.
Or across the street pole.
Yeah, not on fences, it's onto building facades.
Okay. Another question, Sean, before we get over to the public hearing. We've got quite a few cards to go through here tonight. A lot of people have been waiting quite a while. From our staff report, when we had from way back in the study session, we've now gone away from, exceptions over 64 feet. And at the time, you had proposed in the study session back in November the ability to do that with which I think the commission kind of embraced, except it needed more definition, flesh out. Now you've gone completely away from that and just said 64 is it.
Yes,
and
sir.
so could you explain to the commission why we made this big leap of one small step for man and one giant step for mankind?
Absolutely. It was for a couple of reasons. One, we went back and really reviewed, again, what was the direction from City Council, first and foremost. Secondly, we discussed looking at, in terms of ease and consistency in terms of for the community. What is the best way to be able to enforce signs and sign regulations across the board? And after meeting internally, also meeting with the city attorneys, it was ultimately determined that it's much easier, much cleaner for everyone involved, and also gives certainty for those that are coming in, for our business owners, for our business, those that do business in our community. They know that this is the limitations, this is the thresholds that they have to meet, and sets that for them as cleanly and clearly as possible. So everyone's playing by those same rules. So I would say it's a combination of reviewing the direction and just determining what we felt was meeting that direction and the most simplified way to meet that.
So with the current, with this ordinance adoption, let's say, the shopping center you've been currently working on up there off Estrella, then
Yes, sir.
Sports Authority would get 64 feet on the front of that building.
Well, they have an approved master sign program.
I understand that.
Yes.
But if somebody else new came in with a building of that nature, but
If a new development somewhere else in the community were
Infill
to come
replacement.
in, and they would be limited, yes, to 64 square feet. If there was a facility within, for example, using the Estrella example, if there was a change of use, a change of tenant, not a change of use, but a change of tenant, as example I gave earlier was the Sports Authority, I think like a Bed Bath & Beyond, for an example, a retail. The Bed Bath & Beyond would be able to use the same parameters for the larger than 64 square foot sign consistent with the approval of the master sign program. So as long as there wasn't a change of use that triggered the removal of that, or then it would be allowed to continue. The master sign program and that sign exception permit would continue. If there was a brand new facility somewhere else completely in town, you are correct, limited to 64 square feet only. And as part of this analysis, actually, we looked at as staff, how many more situations and locations in the community are we going to be looking at facades where we, analyze the potential appropriateness of a larger than 64 square foot sign? Because, as I know the commission remembers, that was a big part of the discussion associated with the Estrellas, because these were very large facades, very large buildings, and having signage appropriate in scale to those facades is appropriate in terms of not taking away from the aesthetics of the building. And we were looking at the community and how many more times we were going to get such large facades in our community that is, close to 100% build out. We just felt that it would be consistent. 64 square feet is a number we've had for a long time as a limitation in this community, and just moving forward consistently with that we thought was the easiest way to do so.
And for the record, at the time we discussed that the sign authorization would no longer run with the land.
Well, what would happen is that the sign exception, signs larger than 64 square feet, similar with freeway-oriented signs, would be considered non-conforming structures. So, again, they can be maintained. Signs can be changed out consistent with master sign programs, because those are approved and those master sign programs are active. And to be honest, I don't believe I can only think of one instance, and I believe that has since lapsed. I think almost every sign larger than 64 square feet currently in our community, other than the one I'm thinking of, is already in a master sign program. So as long as the master sign program is active and those facilities are active, there's not really an issue where we're going to have to deal with that or the lapsing. But yes, that was a concern in looking at that. But when we did more research and really looking at the city globally, it didn't seem to be as much of an issue moving forward.
Okay, thank you. Any other questions of Commissioner Smith?
Yeah, I get the thing about change of tenants and a complimentary 64 square foot sign. But what if we have a situation where we have a new building and, 64 square feet for the sign, in this case, the scale of the building, its closeness to the street or what have you, is totally inappropriate. How do we measure that and contain that so that the owner of that building can't come in and say, well, you did 64 feet down the street, why don't I get that? So how do we regulate that?
This is obviously would be under different regulatory scenarios moving forward if this were to be approved, right, and the sign exception permits were removed, and so 64 square feet is the limitation. They would be different regulatory situations in terms of what our code says for, as you said in the example you gave, a new building coming forward wanting to put a sign. Now, as I know the Commission knows, is that we do have a variety of signs in which people can potentially choose from to identify their buildings. I know that we've utilized both monument signs and wall signs effectively in various facilities throughout our community. So I would say that, as always, staff is very willing to sit down and communicate and work with potential tenants and potential applicants to, hopefully reach a common win-win goal. And that's what I would say we would look to work together. But, the municipal code is a municipal code, and if that's what's in effect at the time, that's what we'll have to work, with under.
And this would affect monument signs also, is that correct?
Yeah, and already monument signs are limited to 64 square feet, so, I guess they were not changing any of the other dimensions, but the sign faces are still limited, yes, to 64 square feet.
Yeah, just for the record, I wanted to put that out there. And, okay, are there any other questions of staff? Okay, then we'll close the staff question period, and we'll open the public comment, and start with cards. And the first person is Greg Briggs, followed by Robert Nibel, and then followed by Adele Lutz. Okay.
Good evening, commissioners and staff. My name is Greg Briggs. I represent Thrifty Oil Company. We own 2 properties in the city of San Clemente that have freeway signs. The 76 service station located at 1201 South El Camino Real, and the USA service station located at 590 Camino de Estrella. I'm here tonight to express Thrifty's opposition to the potential removal of Thrifty's freeway signs. A significant portion of business for both of these service stations is derived from the freeway, and if you require us to take down or alter our freeway signs, we will be irreparably harmed. And any city requirement to remove or alter our freeway signs will destroy the businesses at these properties that both so critically depend on freeway customers. We urge the Commission to reject staff's recommendation to adopt Zoning Amendment 15-225 in its entirety in order to avoid the inevitable loss of revenues that businesses with existing freeway signs will suffer as a result of this amendment. Thank you.
Thank you, sir. Robert Nibel?
Robert DeBeal, yes, sir.
DeBeal, sorry.
Mr. Chairman, Commissioners, I am the new owner of the McDonald's on Pico. Purchased that restaurant in January of this year. This morning was the first I had heard about any of the sign changes or ordinance. I know Sean sent an email to my office last week. Apparently the city was not aware of the change of ownership. I can tell you that my business relies a lot on transient traffic. San Clemente is not quite big enough to support a McDonald's on its own, and we do probably 40 or 50% of our business from folks outside of the city of San Clemente. I doubt that the restaurant would even be financially feasible without that business. We don't have a very big sign, but it's somewhat of a landmark. We hear customers all the time go, I'm coming from San Diego. When I see that sign, I go, okay, a restroom, finally. And they pull in, grab a Coke, and use the restroom. I have several other McDonald's restaurants, and in several cases we've temporarily lost the sign, and our volume's dropped as much as 40%. And then when the signs go back up, we pick it back up. So I understand a 10% or a 10-year amortization is looked at. That would definitely help us for 10 years, but after that, that business would no longer be viable, and I don't know if I would continue to operate it. So I'm urging you again to take another look at that. The business owners need some kind of signage. Thank you.
Thank you, sir. Adele?
Good evening, Honorable Chair and Commissioners. My name is Adele Lux, and I was born and raised in San Clemente. I've been here 55 years, and I'm the proud owner of Adele's at the San Clemente Inn. The years of 2008 to 2010, 80% of the restaurants went out of business in this town, and in Orange County. Those were the hardest times I've ever seen. As I said, I was born and raised here and worked my whole life in this beautiful city that I call my own. I was one of the 4 out of 5 that stayed in business during that time, and I have to absolutely state that it had to do with the sign. As you know, the San Clemente Inn has been there since the early 60s, so is that sign. It's been here, I've been here just a few years longer than that sign. I think that when you're coming from San Diego going to LA, it's 27 miles of Camp Pendleton. There's little places that you see, you can't get off because it's a military base. What's the first city you see when you're coming north? San Clemente. What do we have? 8, 10 signs that are freeway signs? They're all in good working order, but it's been my experience and my opinion that the city won't grant us permits to make these signs better and more costly, more aesthetic, because we're scared to death we're going to lose our height. As you know, the San Clemente Inn sign is located at the top of the property. I'm sure most of you have been there. San Clemente Inn is located down the hill. We're done. We're shot in the water. We're dead if we don't have that sign. And there's also trees on the freeway exit and off-ramp that are very high that cover a monument sign if we were to be able to switch to a monument sign. So I would highly recommend that you reject this, and we definitely, us business owners, would love to work with the city. We just don't want to lose any more of what we've already lost. I'm coming back. I'm making some money now after those hard years, and I want to continue to stay in this city. I don't want to leave after all this time being here. And if we lose that sign, I don't know where I could go. So please, please think of this small business owner, me in particular. I was born and raised here, worked as a waitress, saved my money, and bought my own restaurant. So please, please, please consider rejecting this offer. Thank you for your time.
Thank you, Del. Brian Whalen from Chino Hills Oil, followed by Peter Rock.
Mr. Chairman and Commission, my name is Brian Whalen. I'm with Chino Hills Oil. We are the operators and owners of the 76 location on El Camino Real and the 5 freeway. If we look back, the city of San Clemente 30, 40 years ago was a different city than it is today. It was a smaller community. It was a bit of an oasis from a commercial standpoint, and I think it was built purposely that way. Our station in particular was put directly off the freeway there. The visibility was made by the sign so that the consumer coming up the freeway through that Camp Pendleton corridor would then see it as an oasis. Hey, let's get off here. For the city, they could capture the business. The city could capture the taxes for the businesses, and it helped the city grow, and it helped the city become what they are today. Without the sign, that site is dead. That is not in a high traffic area of the city. It's in a more commercial area. It's kind of more at the end of the road. It's not really getting a lot of traffic on a daily basis other than what's coming off that freeway from a commercial standpoint. We have another location, 76 location, on Camino de los Mares. And this one is a little offset from the freeway, and this is in an area that was built differently. This has a lot of traffic flow. It has a commercial center behind it. It's sustainable without a freeway sign. But this site itself, the freeway sign and the location and the business are all incorporated as one. And without that sign, there is no business. There's no business for that site. Anyway, so we wish that you would consider this. I think there's a difference in how signs are used in the city, and I think there's a difference on how locations were put in initially with the intent of being that freeway location to pull consumers off, to spend some money in the city, jump back on. Otherwise, they're going to be hanging on. They're going to go to Mission Viejo. They're going to end up at Ortega Highway, somewhere else where they're going to spend those dollars. But from our business and from our perspective, we feel it's detrimental to take the signs down. We feel that the sign was part of the community for a long time. We felt that it was initially permitted to be part of the site in order for that site to be successful, and we wish that you would vote this ordinance down. Thank you.
Thank you. Mr. Rock, Peter Rock.
Good evening, Mr. Chair and fellow commissioners. My name is Peter Rock, and I'm the owner of the property where Tommy's restaurant exists and also Dad's Liquor, and I happen to own two pole signs. Earlier you were talking about property rights. one of the property rights of owning a piece of property is to be able to put up a sign so you can identify your property. If I was a developer and I'm looking for a site that is close to the freeway with an easy on and off, I would look for that property, develop it. Once I develop it and I put up my little business, how do I identify it? I identify it with a sign. So people driving up and down the freeway can easily get off, on and off, and say, oh, this is such a business, I could use that. And our business offers that opportunity because it is very visible from the freeway. I sent some letters out to the Planning Commission. I don't know if you got them. I have copies here. Our sign is not in an obtrusive location. It's located way back in the property. It's about 160 feet from El Camino Real. So I don't see the problem with that. We never had a complaint about the sign. It's a pleasing sign. It's informational. If you drive on the I-5 coming down, you see all kinds of signs facing the freeway, and you see those signs and you use those businesses because of the sign. One I have in mind is the In and Out sign at Avery. It's a nice bright sign, and you can see that right off the freeway, and it's very close to the freeway. Removal of the sign, I believe, would lower the property values. It is an asset. If I was to sell my business, I would say, okay, my property, Mr. Eggleston as an appraiser would know this. You would appraise the property, you appraise the lot, you would appraise the fixtures, the sign, et cetera, and easy communication in and out and identification. I really don't know why you are considering changing the sign ordinance. It's fine the way it is. There are restrictions on it. There's only certain signs that can go up. I believe that you could grandfather the existing signs very easily without affecting or embarrassing the city at all. If the sign is in repair of structural repair, wouldn't that fall under repair? If you have part of your house falling down, you would certainly repair it. That is structural. So that I feel is... Now, we talked about amortization. That's fine. But if I was to call a sign company to come down and tear my sign, he's not going to look at the amortization. He's going to say, oh, that's going to cost you $200,000 to take it down because it's 80 feet up in the air. And you also have to dig it out from the ground so in order to be able to use the lot. So the amortization does not cover the cost of removal of the sign. Also, I have an objection for the change of use. Supposing I see my time is running out. Supposing I sell my place to a doctor and he wants to...
Thank you very much, Mr. Rock.
You know, say that I'm a chiropractor.
Looking
So
forward to when you
we
improve
need
your
those
roof.
signs.
Thank you.
So I would like
person.
to ask you to reject the ordinance.
Thank you. Jennifer Roden, I think, is next. Followed by Adam Qassimi.
Good evening, Honorable Chair, Commissioners. My name is Jennifer Oden. I'm with the law offices of Solomon, Saltzman, and Jameson. My office represents Tesoro Corporation. I hope I'm not out already.
No.
My office represents Tesoro Corporation. Tesoro owns and operates a USA gasoline station here in the city of San Clemente. It's located at 590 Camino de Estrella. You heard from the landlord of that property, Mr. Greg Briggs, whose client is Thrifty Oil. Tesoro is opposed to the proposed elimination of the sign exception permit, as you've heard, and I will not repeat, but I do reiterate some of the comments that have already been shared as far as the substantial value of these signage for the businesses, but also to the public. It provides a value, like I said, especially to the motoring public who's driving by, seeing these signs. If you are associated with a certain brand and like using, in this instance, a gas station as your gas station, and you see that sign, then perhaps you pull off and go to that gas station. These signs are germane to the viability of these businesses. But I would like I said, I will reiterate what everybody has said, and I think there will be more comments in relation to the importance of these signs But I would like to touch on, if the Planning Commission does recommend the elimination of the sign exception permit, it would be requested that you do so without any sort of amortization process. Rather, it be the non-conforming use and be subject to the non-conforming use provisions of the code. So these grandfathered vested rights do have that legal determination as a non-conforming use and can maintain their existence to help with the viability of their business. And I would just also like to touch on option number 2 that was detailed in the staff report. I had a little bit of legal concern or question with it. In reading the option and also the language associated in the resolution with regards to option number 2, it appears to be almost a retroactive amortization process, and the fact that we're looking at this useful life or legal life of signs saying it's 15 to 20 years, when in fact these signs have been permitted under the code, and as we stand here today are conforming, would only get the designation of legal non-conforming signs if the ordinance were to pass and the sign exception permit was taken out. And it's at that time that the amortization period would need to run. We can't go back in time and say, the signs that you've had for 15 or 20 years, they've already had their value, and now we're going to take it away without any sort of just compensation or viable amortization period. I think that turns case law when it's concerned to non-conforming use on its head. So I had an objection or clarification with regards to how that option 2 is outlined in the staff report. And I see that my time's getting short, so I will just sum up and say that Tesoro is opposed to the sign exception permit being eliminated, but if passed, again, we would request that it be a non-conforming use subject to those provisions of the code.
Thank you.
Thank you.
Adam Gassimi, followed by Greg Simos from Rubio's Restaurants.
Good evening, ladies and gentlemen of the City Planning Commission. I wanted to first take the opportunity to thank you for allowing me a forum to speak this evening. My name is Adi Gassemi. I am the son of Eddie Gassemi. He is the owner of the Valero gas station off the Palizada exit for the past 26 years, all of my life. During these past 15 years, we have attempted exhaustively to remodel this location. However, we have met obstacles that have prevented us from doing so. 3 years ago, our plan to remodel was met with approval. However, our request for a resolution with our freeway sign has not been approved. We have invested countless dollars, worked with various architects, hired numerous sign agencies, and presented a myriad of resolutions, yet regrettably, our city has continued to reject our proposals. Furthermore, the city has yet to provide my father with an adequate counter-resolution, despite the various solutions we presented. Our business model is one that depends immensely on the visibility from the freeway. Sitting 75 feet below the freeway, it is imperative to have some visibility from the freeway. In fact, an experiment done by my father recently demonstrated that 80% of our business depends on this visibility. Without this sign, our business will fail. My father and I cannot fathom investing millions of dollars to remodel our business without the proper resources to guarantee our business will succeed. Our close friend, John Adams, operates a service station a few miles north from here. Recently remodeled his gas station, and his business volume increased 2,000%. Without our freeway sign like he has, we will fail to receive similar results. Sitting off the exit of Palizada, an exit that many tourists take when visiting our beautiful city, it would behoove the city to have an aesthetically beautiful building to welcome our visitors. I can speak from experience. When I was a student from UC San Diego, when I was driving up here every weekend to visit my family and visit my parents, it was great to see that sign, to see that I arrived home and I arrived at the city, especially after 27 miles of Camp Pendleton. So finally exit off, grab something to eat, visit the gas station, get some gas. But I wanted to provide an example, a concrete example of how valuable this sign is to our business. Imagine a property, a beachfront property. Imagine that property is worth $10 million. Building a wall around that property drastically reduces the value of that property. Just like removing our freeway sign will drastically reduce the value of our business. So, honorable members of the City Council, City Planning Commission, I ask that we engage in bilateral talks. If you don't accept our resolution, please provide us with a counter-resolution that's adequate. And we can work together to come up with a proper resolution. So I thank you again, and I look forward to our cooperation.
Thank you. Mr. Greg Simos? will be followed by Lisa Francisconi.
Good evening, I'm Greg Simos. I represent Rubio's Restaurants. We have a restaurant here. I'm sure everybody knows it. It's, in fact, we were talking about it earlier in the Camino del Mayor's area. We just spent about $300,000 renovating that restaurant. About 15 or 20% of that was to replace the signs, one of which would be eliminated by this ordinance. Signs, I guess we see them differently. I see a sign as something that helps my business exist and keep in business. We're not a big company, we're not a big restaurant. We sell a reasonably priced product, and every person that comes in our front door is important to us. And I think everybody here is saying the same thing. Signs are part of our business. To say that they're amortized after 10 years is to say that that portion of the business that was coming in the door will continue to come in. I will tell you that's not true. People come because they know you're there, and they know you're there because they see you. We're not a big restaurant. We're not a McDonald's with giant arches. We're a small company, and we don't have pole signs. But people seeing our signs is important to our business, and it's important to every business in this community. I also live in Mission Viejo, and my office is in Carlsbad, and I know coming down this highway day after day, back and forth, how important it is to know what's off that exit, how important it is to know that you can get what you're looking for. I covered the United States for a company not too long ago, and I can't tell you how many times in the dark of night I've gotten off a highway to get gas or to use a restroom or to find a Coke and wound up driving 20 miles because there was nothing there. A sign is part of what defines a community. It doesn't have to be ugly. Looking at signs as an aesthetic thing, I'm all for that. I think that's a good thing. I think it makes us all better. It keeps us modern. That's why we spent $300,000 in the store. We would hope that this community, like so many communities, can create a sign ordinance that allows signs and controls them in a way that keeps them aesthetically pleasing. Part of our business every day is because we have a sign that's visible to a few people from the freeway, and we'd appreciate keeping that business. Thanks so much for your time.
Lisa Francisconi, followed by Scott Williams.
Good evening, gentlemen. My name is Lisa Francisconi, and for the last 25 years, I've had the privilege of running the San Clemente Inn and representing its 5,000 homeowners. During my time at the San Clemente Inn, when I first arrived at the property, the gross rental numbers that the San Clemente Inn was doing at that time was $35,000. I know we all know the formula for transient occupancy tax is 10%. Fiscal year ending 2015, the San Clemente Inn is scheduled to do $1.7 million. 10% of that will go back to the city of San Clemente in the form of transient occupancy tax. Not to mention, the homeowners association pays, each one of my owners will pay property tax to the county as well. The reason I'm here, and Sean was great when we had our open forum, and I heard him kept saying we're all passionate about our signs. Well, obviously we're passionate about our signs. But the reason that I wanted to get up today to talk was to focus more on what those signs do bring to within the community to the other small business owners. And I think the one thing that is very sad for the open forum that we did have, as well as this, I'm not sure of any small businesses that are here, because the reality of our signs and our businesses are that we do drive business into our local small business owners' businesses as well. The petroleum companies, I'm sure, don't do the type of research that we do. I'm lucky enough in my industry to be represented by the American Resort Development Association, and we do track these types of things. And I can tell you that my average client that stays with me will spend $1,800 within the city of San Clemente on groceries, shopping, gas, restaurants, alcohol, bars, and things of that that nature, and that's significant to the other businesses that want to thrive and survive within my community. The thing that makes the San Clemente Inn different than Holiday Inn and the Travel Lodge and all the other big branded companies is that I'm not branded. My pole sign generates income, and of that $1.7 million this year, I can tell you with surety and through auditing that $400,000 of those dollars came from walk-ins that saw that sign that would not know that I existed. How would they? When you get on the internet, you're not looking for the San Clemente Inn, you're looking for Holiday Inn, Hampton Inn, and that's what makes my property unique. And as Adele said, if my pole sign goes away, my property sets back so far against the state park that I disappear in that area. Of course, I oppose the elimination of the permit that's in front of you. The one thing that I want the commission to know is that I'm interested in being a responsible corporate citizen. I've been in front of you before to try to improve the aesthetics of my sign. I want my sign to be relevant and attractive, and whatever we can do to work to keep that is why I'm here today. And hopefully you'll listen to the rest of the individuals and take that into consideration.
Thank you.
Quick question for you. Excuse me, ma'am. Can I ask you a quick question? That $400K that you said came from walk-ins, I assume walk-ins means
The
people
sign,
off of the
yeah,
freeway?
they walk in off the freeway, and when we source code our trackings, we track that as a walk. Rental coming off the internet, Expedia or whatnot is coded as net, and so on. Plant workers are coded as plant. We track everything.
And how do you measure that? How do you know that someone has stopped in because they saw your sign? And
Because when they
decided to
walk
stay?
in, we ask them we just pulled off the freeway. Someone in town, someone at the gas station or at Pete's Liquor Store told us to come across the street, so we consider that a walk-in.
Okay, thank you.
Okay.
Scott Williams? Followed by Steve Knobloch.
Good evening, Mr. Chairman and Commissioners. Thank you for allowing us to speak. I represent Valley Integrated Company Incorporated, doing business as San Clemente Shell at 2400 South El Camino Real. The station is located about 60 feet above the freeway. The sign is important. I would like I'm a native Californian, but I'm not a native San Clementian. But you folks are familiar with the boneyard of service stations that have met their demise with the lack of a sign. And you can come off at El Camino Real, Calafia, and I think about every other Christmas tree lot used to be a service station with a high sign. So there's your empirical evidence. I agree, I think you all agree, that signs are commercial speech. And I'm trying to look at this. You understand what freeway visible is, or freeway orientated. I went back after that meeting, we had a study session, I'm going in my mind, how do you figure that out? So I made a chart. I say, okay, I've got freeway orientated, I've got freeway visible. The orientated, you want to eliminate their signs because they're pole signs. But they both engage in commercial speech. They both engage intended to reach an audience in commerce. Number 3, they intend to attract potential customers. That's in common. They engage in commercial speech. They engage in retail sales and service. They also create retail sales tax at 8%. But with the pole signs in the business that we're in, it's a family-run business, it's a fuel sale of gasoline. We generate not only sales tax, but 53.7 cents per gallon in excise tax. That's 18.4 cents excise California, 35.3 cents for federal tax. The total sales tax and excise tax is 75.3 cents for every gallon. So that's a lot of money. You can say we only get 1% of the 6% or 8% of the sales tax, but you get benefits. You're part of the Orange County Transportation Authority. That sales tax money, excise tax money, comes back to your community. In summary, I would say that the freeway visible signs and the freeway orientated signs are same and of like kind business. They are treated differently in this amendment. which would cause harm and economic loss to those businesses that are designated freeway-orientated. The differences between the definition is vague and ambiguous and without merit.
Thank you, sir.
Thank you.
Mr. Steve Knobloch, followed by David Sanner, and then followed by Ron Chopra. Mr. Knobloch.
Yeah, Mr. Chairman, members of the commission, Steve Knobloch, I'm a resident of San Clemente, former member of the City Council, Assistant General Counsel of the Craig Realty Group, which is the principal and operator of the San Clemente malls, outlet malls. I want to speak against this ordinance for a number of reasons. Number one is there doesn't appear to be any particular community of purpose for this ordinance. There was no major outcry, there was no major concern, there was no complaints that I know of or that I've heard of or I've read of regarding this. The staff analysis that was prepared didn't include any discussion of problems that need to be addressed. And when we read the ordinance, a number of speakers have discussed the problem with commercial speak, and this really discriminates and causes a problem. We can't distinguish between freeway-oriented signs and freeway-visible signs, nor do we think you should make that distinction. The premise of this ordinance was quality of life in San Clemente. And, Ole Hansen, who defined the Spanish village by the sea, and where we all quote when we're talking about quality of life in San Clemente, was a developer. He was a builder. He built signs. He built large signs. He built large freeway-oriented signs. If there had been a freeway in San Clemente at that time, he'd have built large freeway-oriented signs. And there's really a problem with trying to outlaw these. Now, I don't know what the motivation for this is, but I know when I read in the newspaper that certain council members consider these signs public nuisances and vote against signs and other projects because they don't want to have to grant the outlet mall a sign. That concerns me because you're taking a public trust that should be seriously considered and transferring that to other businesses in town. It's really problematic. Now, I appreciate Commission Member Eggleston's comment and request of City Council regarding the vesting of our signage, and I appreciate those comments. However, I'm not so convinced the city views this the same way. 2 days ago, we applied for an administrative permit for a temporary sign, a sign that should have been issued over the counter. It complied with all the statutes, all the rules, didn't violate any, and I was told 10 days before Christmas by planning staff that this would take at least a week for the city attorney to analyze. This is something that should be granted over the counter as routine, and we're getting, we'll think about it and we'll get back to you. I would really suggest, gentlemen, that you oppose this ordinance. It really shouldn't be, there's no need for it in the city, and I'd recommend that you oppose it in your entirety. Thank you very much.
Thanks, sir. Mr. David Sanner.
Mr. Chairman, fellow council members, I wasn't going to speak tonight, but and I really don't know many of the speakers, but a couple of things occurred to me with respect, especially with the petroleum companies and the small businesses who are worried about the amortization portion of this proposal. And it seemed to me that they were saying that you may not only be amortizing our signs out of existence, you may be amortizing our businesses out of existence, or significantly reducing their value. So I hope you'll take a close look at whether it's worth putting the amortization portion in this proposal at all. My second comment with respect to just being a freeway driver is that we've all experienced this, where we've come into a new town and we're about out of gas and it's at night and we're desperately looking for some place to go to get gas, and especially in this area where there's significant non-developed area. So I think that would help promote safety for people that are driving too, who need to get gas. My final thing is kind of following up on Mr. Knobloch brought up. I was wondering if we could ask staff if there is in fact a rash of applications for freeway-facing signs that where this is becoming more of a problem with the city, and they want to, maybe cut off all those considerations. I'm guessing there hasn't been a rash of applications, and and which makes me think that the present system probably works just fine. It gives you discretion when it comes to freeway-facing signs. You still have the power to, approve or not approve, as opposed to being very dogmatic about the whole thing. Could we ask staff that question, whether there's been a rash of applications or that would have promoted this consideration?
The commission doesn't have any knowledge of how many applications are. Maybe the city planner could illuminate it, but we don't have that information. It's not contained in the report.
Mr. Peaches, do you have any idea?
There's one application currently on the books. There was a previous one earlier this year, and the last one I remember before that was the Montgomery Motorcycle Company. Do you remember what year? That was probably a couple
That's about
years earlier.
2-3 years ago.
Must have been at least 3 years ago.
Okay, thanks very much. I appreciate the time. I would ask you to just think from the perspective, is this really something we need to do at all? Thank you.
Okay. The last card is Mr. Ra Chopra. Please speak into the microphone.
Sorry, no, I'm not feeling that way, so I'm sorry if I'm kind of lost here.
Okay.
Good evening. I own here a Denny's restaurant, which has been in existence since the 60s. And Denny's? Yes.
Oh.
And I've been part of this community for the past 16 years. Our restaurant has really gone down when the economic crisis hit. I know that there was a Denny's restaurant in San Capistrano. The previous, the oriented sign was taken down, and their sales dropped over 40% at that time. This sign is the blood of my business. If this sign is taken down, my business is gone. My property value, well, we all know where that goes. This is the only restaurant I have, and that's, my family is supported on it. I have asked the city that I will beautify the sign. I will make it modern. I will change it to the neon lighting, the new lighting, the less energy, but I just can't do that. I maintain the sign. I bring the sign company in every few months, okay, and have them replace that open neon. That technology was 60s technology. That open neon does not work today. It's expensive. Most companies do not make it. They have to craft each letter, and it costs me thousands of dollars just to maintain it, and I want to maintain it because I want to keep this place beautiful. It's my place, it's my business, it's my city. So, all I'm going to request you is please, the signs are not doing any harm. You have heard everybody and all kinds of outcry. I please request you to reconsider your decisions. Thank you.
Thank you. Are there anybody else in the audience here tonight that has not had the opportunity to speak that would like to? If not, we'll close the public hearing. And you're on another thing. You're going to be allowed to speak on item 9. We're not there yet, okay?
What item are we on?
We're on 8. Okay. Previously discussed. Okay. Well, that will generate discussion.
Okay, I've got mixed feelings on this issue. I think the sign limits on buildings, I can accept all those. Signs are what they are as far as the building of 64-foot max is fine. New signs that are freeway oriented, Since that's only going to affect new applications, that's fine. I think on the pole signs, I've kind of taken a big turn on this. It doesn't seem like we've really created a solution by just saying they got to come down. That's not necessarily a solution. And the benefit to the city is such that, does it beautify the section of freeway for the freeway drivers? Yeah. I think we can all agree on that. But I am concerned that the particular lots, particularly the gas stations, are actually difficult sites to put some other business. And if the gas stations move, one, there's a huge cost in cleaning up the sites and redeveloping them. And what kind of businesses would want to be, it's certainly not going to be pedestrian oriented on those corners like we always talk about our local businesses. And does it drastically affect our quality of life? Certainly not drastically. Is it a nice little section of freeway? Luckily, I don't drive the freeway anymore. I drive in town. My office is in San Juan. I go to town, and I don't have to go on the freeway. And I don't see anybody here clamoring to have the signs down. And I'm working off word of mouth to hear those that want the signs to go away. And I think the city council deserves both opinions rather than just yes men to say what they think. And the only solution I really heard was forbid this from the attorney, that if we do ban them, that I don't think I'm in favor of the amortization. I'm thinking that maybe these businesses deserve to stay in business. This isn't, when I came in tonight, wasn't the direction I was leaning after researching it on my own. But I think Sean's done a real good job on the other signage issues and all. But as far as, I'd love to see the signs go away personally, but I don't see the benefit to the city versus the downside of having those vacant businesses. So I think the most I could support would be this without the amortization. And go ahead and convince me otherwise.
Okay, thank you, Commissioner Crandall. We'll move out to Commissioner Wu. You have your light on?
Mr. Smith.
He was first? Well, thank you for
Okay, I'll go next. The way I see this issue in front of us right now is that there's really three different parts to what we're talking about. And the first part, just to start to peel these things separately, is this kind of temporary signage. And I'm not hearing people talking about that being a problem and us fixing it, and probably everybody's relief that we'll be doing something about it, because quite honestly, I think it's a blight on the community. And I don't know about you, but I saw a lot of it on chain link fences and other places where it did not belong. And people were getting away with murder with those things. So that's a good thing. I think we can say, yeah, that's a good one. We'll clean that up, get that out of the way. Don't want to see that again. And then I think the other issue is that we're talking about signs on buildings. And I think that it's reasonable to assume that buildings are going to have signs on them. And we're not saying that they're not. We're just saying that we'd like to limit the size of those. And the only difference that we're making on that is the fact that some of those buildings may in fact have signs on them that aren't facing the front of the buildings but are in the back of the buildings. And the only reason that they're on the back of the buildings is because, guess what? So they can be seen by the freeway, and that's the only reason that they're there. As a matter of fact, we recently went through a signage program approval where we had a developer tell us that the the tenant would not take the lease, would not participate in the project if he didn't get the rear signage on the freeway. And we hung tight and said we didn't want to do that, and lo and behold, that tenant decided that it was, at the end of the day, it was okay for them to live with the signage that they had in the front of the building. And it was sizable. It was 64 feet. So where are we with all this? We're looking like, I'm thinking, we're talking about pole signs. Everybody here today said pole sign. And that's what I think we need to address that specifically. And it's interesting for me because I did a little bit of homework. I got some historical photos that I've looked at from San Clemente from its very beginning to up into the 60s and 70s. And I can tell you that it's amazing to see these old photographs because they are chock-a-block full of the biggest damn signs you've ever seen. And up and down Del Mar, there was big signs. And, you know, if you were to see that today, you'd probably laugh and go, oh my God, I can't believe that that was the way it was. Well, back then, everybody probably said, you know, I need this big sign because if I don't have this big sign, I'm going to be out of business. And that probably went on and on and on. But something happened. Something happened over a period of time where those signs have pretty much disappeared. They're not there anymore. And I'm not sure anybody that's on Del Mar is saying, well, I can't run my business now because I don't have a big sign on my building. I think that things change over a period of time. And I think that that's really kind of where we're at with this pole sign issue. I think we're talking about changing, and we're talking about over a period of time. Now, is it reasonable to assume that if you have a pole sign on your business that you deserve to have that forever? Forever and ever? Well, maybe you think that way, but maybe that's unrealistic. Maybe that's looking like, well, the whole world will be full of pole signs if everybody thinks that way. And can you imagine now that your pole sign is in a forest of pole signs, you're not getting the visibility you used to have when you were the only one by Estrella. So there's a moderation here to consider and an appropriateness to consider. And I think if the city thinks that a goal should be to get rid of pole signs on freeways, then they have to come up with a way that seems to be fair to business owners that have them. And I think that's what you're saying. You're saying, yeah, you just can't take it away because if you do, you're going to ruin my business, and probably you would have a big impact if those pole signs were to go today. But I think the history of this town shows that pole signs and things like that have a way of going their own way in a period of time. And so what I think we need to do is put a reasonable time limit on pole signs. I'm not sure we need to get into all of this technical stuff about depreciation, amortization, whatever you want to call it. But maybe what we need to do is say that you can keep your pole sign for a reasonable amount of time, and then after that, it's probably going to start falling apart. And when it starts falling apart, that's when we're going to put an end to that, because it's seen its life.
Thank you.
And we have a goal. We have a
Wrap it
goal
up,
here.
please, a little bit so I
let me finish. So I think what we're faced with here, really, to be more practical about it, is why don't we set a time limit? Why don't we determine a time limit that makes some sense, that you as building owners and businessmen can say, well, that seems reasonable, I can live with it. And so I would start by saying you can keep your pole sign for 25 years.
Thank you. Commissioner Eggleston.
I'm going to take this in several sections here. On the temporary signs, I think it's important for us to clean that up. But I think it's also important when it comes to the 3-foot limit, because last time in a political campaign, there was a lot of controversy with regard to that. And so I think that we should eliminate that 3-foot limit, quite frankly, because there are limitations there where buildings may be, 2 feet from or houses 2 feet from the sidewalk, then you can't put a sign in. That's not reasonable to do. But I think we need to clean it up. And if we're going to clean it up, we need consistent code enforcement, because we really don't have consistent code enforcement when it comes to garage signs on telephone poles, for example. And that's a problem, because you can go up and down El Camino Real on a weekend and you can see these garage signs all over the place, and they're really obnoxious, quite frankly. So I think we need consistent code enforcement if we're going to put the temporary signs through. I'm okay with the 64 square feet. I think that's fine. I also have mixed feelings about this, as you do, with regard to this. I don't know what Tommy's is going to do if the sign comes down, quite frankly. I'm going to have to eat there for breakfast with their world-famous omelets and their lunch for their world-famous fried chicken every day, just to make it up for if that sign comes down.
Thanks for sharing the menu.
A promotion for Tommy's. The Denny's sign, he maintains that sign all the time, and I can see that, in fact, that the type of sign that you have there is really difficult and expensive to maintain. It's very expensive to maintain there. I think, though, that when you have a substantial change of use, and I don't think the Valero's change of use is substantial, quite frankly, that you're proposing there. I think when there's a change of use from one type to another, I think the signs need to come down, such as the Carroll sign that finally came down because they went out of business and there's no one there right now. The 76 sign on El Camino Real, the fellow spoke about that, needs to be repaired. It's faded and it needs to be repaired. And so I think that's important. I don't think, though, that we should be punitive to owners of pole signs. So how can we come up with an alternative? I don't think the city should come up with an alternative. I think you all should get together and come up with an alternative for the pole signs, because over a period of time, the pole signs will come down, either through just just falling down or whatever, or change of use. So I think it's important to come up with that. And you know, we're known here as the Spanish Village by the Sea. Wouldn't it be nice, you know, and this is just an idea, to have a monument signs that are designed, that are stucco, that are Spanish colonial design, that would identify your business along the freeway on your own property, or if you could lease some property. But I don't think we should be punitive as sign owners. And so somehow you all going to come up with some sort of alternative with regard to the elimination of pole signs. And I think that's really, really important to do. So I'm still have mixed feelings about this. I don't know what direction we're all going to go here, but come up with an alternative. Come up with an alternative. Thank you.
Okay, Mr. Wu, we'll go back to your side.
Thank you. I'll chime in with my thoughts. Firstly, the city is certainly in its power to amortize any non-conforming use. The real question is if it's reasonable. For most of the signs are utilitarian for those gas stations, but some of the signs, especially Tommy's sign and Denny's sign, and they gave me a nostalgic feeling. And it's a reminiscence of the bygone time of San Clemente. It's actually, I think it's a part of that small town charm of the city. So they're not a public nuisance in my viewpoint. So the negative impact to these family, most of them are small business run by family, they're local business. The negative impact to these businesses by the amortization outweigh the limited benefit of amortizing them, because the benefit will be the beautification of the freeway, but comparing to the impact to this business, I think it's not enough to justify it. Not to mention that it will expose the city to some Fifth Amendment claim. We all know that just compensation cannot be decided by IRS depreciation schedule. It's dependent by the market value of that. So to sum it up, I support the proposed zoning, the proposed sign ordinance for the most part, except for the amortization. I think we shouldn't put amortization there. Thanks.
Thank you. Thank you for being quick and brief, too. So, your turn.
Thank you. Okay, so a couple weeks back, I got a call from a friend out of the blue asking if I'd care to meet for lunch. And I said, yeah, that'd be great. He's coming up from San Diego. And he said, well, where's there to go? And I said, wherever you want. He was on the freeway, and he said, well, I just typed in coffee in my nav, and it tells me there's a Starbucks off El Camino Real. So would you meet me there? I said, yeah, that'd be great. So we met, and I asked him how that worked out and if it was easy to find, and he said yes. I thought that was very interesting. And that supports my thoughts on this. I think that pole signs are really a fading necessity. I just don't believe that that as time goes by that folks are going to be relying upon freeway signs, specifically large pole signs. I think folks have basic needs that are commuting, and that is for gas, for food and beverage, and restrooms. They're going to hit their navigation. By the time they hit that freeway sign that's there, they've already passed it. You know, they're not going to, it's not going to be convenient in most cases to go to the next exit a mile up, turn around, and go back again. So they're going to be relying upon memory at that point if that's all they've got. So I just have a question for Sean. How many pole signs do we currently have adjacent to the freeways here in town? I know you did a report, and I just don't have that number.
I can look at the number. I can also count them up really quick for you again.
Roughly, is it half a dozen?
Yeah, I think it was like 13 off the top of my head.
So 13.
So we'll say 13 to 15 off the top of my head would be the number I'd say.
Okay. Of those 13 signs, I took a couple drives up and down the freeway along the primary corridors, and to Commissioner Wu's point, yeah, I think that some of those signs are a part of our historic fabric, at least of the built environment, right? Part of our history. There is some nostalgia there. Are they necessary? Now, maybe. In the future, I don't think as much. That's my thought on that. So, the way this amendment is written, I think it's well written, and I support it. But I too have reservations about the amortization options 2 and 3. I think that option 1 would be the best way to move forward with this. It gives folks with existing signs an opportunity to maintain their business and operate, but I think it warrants some massaging. I think the language almost gets there, but we could add something, for example, to the last sentence. It says, this process would be consistent with the city's practice for the past 2 decades, which required removal of non-conforming freeway-oriented signs when a change of use occurs. And if we add, or when a significant change in the request to the character of the sign occurs, or when the structure is found to be structurally unsound, and as such would be potentially unsafe to the public. I think those would be good additions to that condition, to that option anyway, to make it a little more viable and applicable. And over time, there would likely be a change in use, and that would be the opportunity to revisit the situation.
Okay.
And I think that about does it. Thank you.
Mr. Ruin?
I'm going to touch on each of these items, but I think there's a couple of things that were mentioned during the public comment we need to clarify, so make yourself comfortable. And
we're going to blow a horn because we're not going to have a sermon like Commissioner Eggleston or Smith, okay? So be quick.
My sermons are better. So the first thing was a question about amortization. I've now heard 2 different calculations of when amortization starts, or the depreciation, whatever you want to, whenever the clock starts. And one is when the pole is constructed, and one is when people get informed. So maybe you could clarify that for us.
Mr. Chairman, Commissioners, there are 2 terms at play here. There's depreciation and there's amortization. Depreciation begins when the asset is constructed. That's when it begins depreciating. Amortization begins when the code says that amortization begins. So depreciation, which looks at the actual value remaining right? If a sign was constructed in 1950, it's been depreciating since 1950, subject to any improvements that have been made since that time. The amortization schedule is what is in the code.
So we could say that it starts, we could say in the code that it starts when the sign was originally installed.
The depreciation of the sign?
Yes.
Yes.
So it's fully amortized after, if we say it's 30 years, just to pick a number. If the sign's been up for 30 years, it would be fully amortized then, even if today is that 30 years. It doesn't start.
Depending on how we phrase things in the ordinance, yes. I think it's important to note, though, as has been mentioned previously, calling something fully amortized doesn't necessarily result in a silver bullet in terms of the
I understand.
the cost component.
But we can start the clock wherever we decide to, based on what we put in the zoning ordinance.
That's correct.
Okay, thank you. There was also a comment about no major outcry or concerns. I think a lot of people didn't get direct notices of this, except for the businesses that were, of course, directly affected. I think all of us have seen when a new freeway sign or pole sign is coming up in town, there's a lot of pushback from the community, a lot of kind of hue and cry. So I think that's where, I don't want to speak for the council, but in my personal opinion, that's where some of this comes from, just to address that, that comment. So there is a sense in the community that, fewer freeway-oriented signs would be a good thing. So talk about taking the big issue first, the freeway signs and amortization. We've looked at a number of, in the time I've been on here, a number of pole sign removals because of the change of business. They've all been removed. Over the last 30 years, I think there's something like 8 or 10 pole signs that have been removed. To my knowledge, none of those businesses have gone out of business. All of those are still going concerns. So, that is kind of a fact of history I think we have to take into account. There's obviously and understandably great concern among the business owners on how it's going to affect their business if they lose a pole sign. I've seen numbers like 40% of their business, 80% of their business. Ms. Francisconi has provided, I think, the most objective assessment that I've heard, and I've asked throughout the years as people were saying, don't take my pole sign, don't make me take my pole sign down. I've asked, where is the evidence, because we have findings we have to make, and no one has been able to provide evidence of what the actual impact is going to be. I've had small businesses, large companies, and in the end, people end up opening the businesses anyway, or the pole sign comes down, and no one's gone out of business. So this is not to say that the concern is not justified, or certainly not unreasonable to be concerned with that, but that's the history that we have up to now, and I think that we've got to get our arms around that history as well as what the people here are telling us. Because as we look at that history and we look out at the community, that as the needs have changed, people want less of the pole signs. I'm in the minority, I guess. I don't feel, I've driven by here my entire life, 55 years. I don't feel nostalgia for the Denny sign or for the other signs. In fact, Pico is my exit. I look at a sign like the Denny sign or like the Union 76 sign that you had referenced. The lack of maintenance, kind of constant lack of maintenance on those signs reflects in the community. I think drivers see that and they say, oh, that might be a down at the heels neighborhood. I'm going to go to the next exit. So that's a concern of mine for these pole signs that don't have the maintenance that they should have. And I know the Denny's is the one I'm most familiar with, and I see that, in fact, right now it requires maintenance. So I think that's a problem. The people are you embrace your pole signs, which I understand, but the concern I have if we don't amortize is that people will keep their sign beyond when it should be and won't perhaps admit to themselves when structurally the sign needs to be replaced. And that makes me feel like we need amortization at some level, at some point, so that, because we know it's going to wear out at some point or another. That's just, things rust, So if we just let it go and grandfather it, then we run the risk of these signs really going beyond their useful life. So I think we should amortize. 64 square feet of signage, I think that that's probably a good thing that's going to help us with our, actually in design review, looking and comparing the sizes and nature of these signs to the buildings. It's also going to give us a standard in the buildings to understand when people come and we get architectural approval. Oftentimes they haven't done their signage yet. We'll have something a real stake to put in the ground in terms of saying this is something that might or might not work in terms of the signage. Political and non-business signage. I think that what's currently in the ordinance is good. I think if we adjust it for political purposes, then we've got all the non-business stuff that we have to worry about that might be encroaching, and that could be an issue. So with the big issue, the signs, my preference would be to have an amortization process that gives the city council some flexibility so that they can say, older signs perhaps get amortized quicker than younger signs, but that we should do that as a matter of safety and ultimately getting to this point where the freeway-oriented signs aren't an issue in the city.
You're done. Thank you. Okay.
We're all over the place.
You're clear to go to church Sunday, I guess. All right, I've saved my comments for last. We were not very strong on our general plan on one topic. Are we in the freeway business or not? Are we in the freeway serving business or not? It's not, it wasn't a standout focus in our general plan, and after 40 or 50 meetings on that, that's the issue before us in some ways. To summarize, the 64 square feet I'm good with. I think that's an overkill from where we started, but I'm comfortable with it. The temporary signs, I'm clear with that. The Supreme Court rule has given us guidance. We'll follow the law of the land. The freeway-oriented signs, we have certain grandfathering. We have other issues with that. The pole signs, we have had I guess, Jim, you've been around since, well, never mind, you're pretty young, but we've had a policy, I guess it is in the city, for a change of use that the pole sign comes down. Now is that an ordinance, or what is that? Where is that codified anywhere? Where is, are we blazing new ground with finally getting in the ordinance after a policy decision of some 30 years?
We're clarifying it in the code proposed now to make it clear, but it's always been it's an interpretation that first of all, one thing that was said in this meeting today was that someone mentioned, I think one of the attorneys, that pole signs are now legal and they'll be made non-conforming. They're already all non-conforming. The maximum height for the pole sign in this town is 15 feet. Almost, there may be one in here that's 15, but most of them are well over 15.
And that was established how many years ago?
Yeah. Oh, quite a long time
20
ago.
or 30 years ago, right?
Probably in the 90s that occurred. So they all have a nonconformity on them. So with the change of use, the nonconforming comes down because it's a brand new use. The use doesn't continue with the nonconformity doesn't allow to continue with a change in use. So that's how that interpretation has occurred over the time, and it has brought down. We can get the numbers, but it's probably a handful, 10 maybe, over the years. And so if you wanted to continue on that path without amortization, eventually the pole signs will come down. That's one option. So anyway, does that answer your question?
Yeah, it does. I mean, in other words, it's been on the books for quite some time. The big key then becomes, I think what Mr. Eggleston brought up, is the definition of change of use.
Exactly.
And so,
what is the change of use?
Thank you for, after your sermon, but butting into mine there. So the key here, I think, the decision before us in many ways is, are we in the freeway, is a segment of this city in the freeway business or not? Our Main Street is I-5. Our historic Main Street is Del Mar. But, you want to get on a freeway and go to Trader Joe's, you get on I-5. That is our Main Street. And so maybe we need to have a recognition, and it's not very strong in our general plan, about freeway orientation or freeway businesses. But to me, I'm not going to be supportive of amortization. I like to see these signs repaired or kept up to date or up to speed without retribution. I'd like to see maybe possibly that the the definition of a change of use. If it's a gas station, it's still a gas station, maybe that's okay. You know, a restaurant's a restaurant. Mr. Rock owns a rooftop that's atrocious, and it's a major viewpoint coming into our city, but after that, I look at Entrada Top Tune, which is the next ugly empty gas station across the street, and I like to see him improve his roof, like Sit and Sleep, without, you know, the danger of his sign, without, you know, whatever. So I'd like to see this change of use somewhat reviewed, so that these businesses can be viable. At the same token, their signs were kept in good taste. You know, and I'm not for amortization, and I'm willing to go with, over time, as the gas station goes out of business, or for whatever reason, the family business, you know, decides to, you know, change or whatever, then the sign comes down. We've, over time, eliminated a good deal of them, and that's kind of my position. The way I add it up right now, there's about 4 or 5 of us that are in favor of no amortization, and there's 2 that kind of want to amortize if I did a straw vote here. To wrap this up, we have some language, I think, that Commissioner Blackwell offered to the no amortization thing that might have some merit. I don't know what the commission is on that, but we've been at this for quite some time. Let's move towards closure so we can get our new business issue done. And
I'd like to make one comment on the amortization.
Yeah.
And the problems involved in that is everybody says, well, the value of let's say they put up 25 years ago a $50,000 sign, and it's been amortized, and we say it's not worth anything now. It's probably going to cost $200,000 to take it down. So where does that number get factored in? We can't put a penalty of removal on these
I think that's in the tables, isn't it, Mr.
I mean,
City Attorney?
Who puts that money out there?
Mr. Chair, Commissioners, the value of a sign and its remaining useful life is actually, there are criteria in the B&P code and the California code that include issues like removal and possible replacement. So it's not just a matter of the, you know, the 50-year depreciation, but you also take into consideration things like removal and possible
Well, I'm just wondering, will we take it into consideration, but that business owner still got to pay that money? Somebody's got to take it out. And it could put the company out of business. And that doesn't make sense to me. I mean, if the city wants it down that much, you would think, oh, well, if it's worth that much to take it out, kick in and help them take it out then. I mean, I can't see, that's why I don't like the amortization and that whole thing. It just gets too complicated. Could be very expensive also.
Very expensive.
For the city. And it may not be cost benefit to the city.
Does it, I'm sorry, does it not beg the question that at some point it's got to come down just because of the wear and tear on it?
Well, that's pretty well included in the maintenance
but then when
codes already. There, I
Is
mean, there's.
Well, I think we talked about that earlier with the non-conforming situation. The 50% rule that I know Mel talked about, our city attorney. So there's provisions in there that if it outlives its useful life and it, can't be rebuilt, but without, there's a certain point in time where the scale tips to it's no longer a rebuild maintenance, it's a brand new sign.
But that,
just like a house,
But that depends on the owner coming up and saying, okay, I want to do X, Y, Z on my sign. I need to repair it. Oh, it's going to be whatever, however we measure 50%, at least 50% repair on a sign. And then there's the back office saying, well, no, I want to try to keep my sign for a little while longer. Now you've got a sign that actually does need repair or removal because it starts to become a maintenance issue or a danger. And, what's to say that it's not going to be, well-intended perhaps, but still a problem for the community because of that. I mean, how do you measure that?
You red tag it.
You red tag it, just like you do a building.
Building apartment.
Even in a maritime environment, if the mounting bolts rust to the point where, you got to get a crane and lift it all up and replace it, then somebody's got to make an engineering judgment call of the cost of repair.
Do we make an inspection like that?
They do that.
How do we know, I mean,
We don't, it's just like a house, we don't make inspections on people's houses. It's, if there's a problem that's, noticeable, I mean, when there's a building that's not in repair, then code enforcement will go out and ask for the maintenance requirements to be implemented.
so what, I mean,
And
so
signs
what
can
would-
occur the same way. We've had some signs that were, I think, over time removed, that were kind of abandoned and became a hazard, and those have been removed, like the Carroll sign that was asked to be removed. That was actually because of its expiration of use. But yeah, we can and have in some cases enforced, either the repair or maintenance because it's not being upkept properly, or in an extreme case, and mostly I'm more familiar with buildings because that's more common. We've even asked or required buildings to be torn down because they were beyond the point of, restoration or brought back to normal standards.
You want to talk now?
Yes, I can if I
Shortly,
may.
and make it short.
Very short.
So I know it's against nature, but it's okay.
What are we going to do with something like the Denny's sign? The Denny's sign has really, it's extremely expensive to maintain. It's a huge sign. The owner wants to do something different with a new sign, but we haven't really addressed that, for example. I mean, you go past the Denny's sign, and most of the time it's not working properly. He does his best to repair it. He wants to take it down and put a new sign up. How are we going to address that? I mean, that's up for discussion, I think.
Well, I think we previously discussed about you can make existing improvements to existing sign within the footprint. I mean, technological improvements, that's allowable now, isn't that right, Jim? I mean,
You can repair and maintain.
Or can he, in fact, improve the existing sign with something other than neon, let's say?
He has limitations on, he has to maintain the existing sign type. So he can't change it from one type to another. He can't change the square footage. Not quite sure, maybe I'd defer to Mel about, whether it has to be neon or if it could be some other comparable.
Just the Denny's sign is the Denny's sign. It says Denny's. It's just, it's the same footprint. It's just you swap out neon for something state of the art.
But isn't that like
does that break the nonconformance code, so it means the thing comes falling down?
I'm not sure. I think I'd have to refer back or study that with the city attorney, whether they can change the neon. I think that the city's position in the past has been that a non-conforming sign, if it's a plexiglass sign, can't change to a neon sign or vice versa. It can't increase in square footage, but they can change, say the Denny's logo changes. They can use the same kind of technology and update their logo, or if Denny's changes to Applebee's or something like that, Applebee's could come in and put a neon sign up there in replacement and be in conformance, so long as it's not bigger.
But Denny's logo has changed over a period of time.
Excuse me, Commissioner Blackwell would like to talk to you.
I was just going to say, so the maintenance of a sign is the cost of doing business for a business owner, whether it costs a lot or a little. That is the responsibility of the property owner to maintain that structure, that element on their property. And if it's the lifeblood of the youth, I would think that would be a priority in terms of maintaining that in a timely manner. So any change to a sign that makes sense within the envelope of the existing built environment, but any increase in size or shape could impact the structure and would, I'm assuming, require a building permit. Again, we talked about this. That structural analysis would be required as part of that application, and that structural analysis would reveal whether or not that structure is structurally sound or would require significant upgrade or potentially swap out.
You would support like for like, though.
Yeah, so it would be like for like, absolutely. So I think we're protected.
Commissioner Smith, your best 60 seconds.
Well, I don't know if I can do it in 60 seconds or not, but I think we're really close here, and let's put some perspective on what we're doing. I think we're in agreement with the temporary signs. I think we're in agreement with the 64 square foot stuff, and I think what we're really doing is we're fussing around with the pole sign. And I think that there's a solution there. I think we're smart enough to come up with something that's going to make them feel good and going to make us feel good. And our objective here is to actually reduce that over a period of time and have a city that's not full of big pole signs. And I totally agree with Commissioner Rulin that technology is going to change. You're going to be able to say, I want some pizza when I go through San Clemente, and it's going to guide you to a pizza place. You're not going to need a round table sign on the middle of the freeway to do that. As a matter of fact, my wife and I do that all the time when we travel. So that's right here and now. So let's look at what we can do. One is that if we have a major change in use on a pole sign, that should be the end of it. You know, you're going from one business that's your lifeline now, it's going to somebody else that's new on the block, and we're not allowing new ones on the block anyway, so goodbye pole sign. We have maintenance issues that if it's not well maintained or if it's past its life and it's a hazard, goodbye pole sign. If the owner keeps it up and does a good job on it and it's a lifeline for their business, then they ought to be able to keep it up. I think that we're still back to a timeline, and I don't agree to amortization either because I think it's too complicated and I think it's arguable. But I do think if you put a reasonable time limit on it and say that, you know, we're going to have a sunset clause on your pole sign, and it's something that you all can live with, and it's reasonable, then I think we've got this figured out.
Thank you. Commissioner Rulin, best and final offer.
Take it easy.
60 seconds or less.
It's going to be more than 60. We were using Denny's as an example. I think it's kind of a good example for this. If we don't do amortization, then we've got that question of how do we know when we get to that non-conforming point, that 50% point that we use in the non-conforming judgment. I'm not sure what that looks like in a sign, but when we have Denny's, we have an example where it becomes cost prohibitive to maintain it, and we see it kind of consistently not be, maintained. And even though the owner's trying to maintain it, the parts are hard to get, et cetera. We can't change it to an LED sign, I don't think, because that would be changing the type of use of the sign itself. So it starts to sound to me like, well, it's been about a half century, that sign's been there. Does that mean that it's reached the end of its life? How do we, that's what I'm trying to get my hands around. How do we judge that if we don't amortize it? And I'm not saying we should. I'm asking the Planning Commission, how do we judge that? Do we know that this, for instance, that the Denny sign is close to the end of its life? Is it does it require 60% replacement, 40% replacement? How close is it to the non-conforming, and how do you judge that?
50% is the legal term.
But what's a 50% of a sign like that? How do you, there's things we have in
buildings, it's 50% of the appraised evaluation at the time of the removal or the destruction or whatever the lack of repair.
So we do have a way to measure it for a sign?
Well, that's how it's defined, I know, with the non-conforming section of the code.
That's right. So we don't need to build another watch or have a problem looking for a solution.
Real quick, I think we pretty much agree on the 64 square feet and the temporary signs, for me, except with the exception of the 3 feet. But I think we're all over the place here with regard to the pole signs. I think we've all said a lot of things here. I think the staff needs to come back with some suggestions with regard to what we've been discussing here with regard to define usage, change of usage. For example, I don't think, for example, Valera, that what they want to do for a change of usage is significant enough for them to eliminate their sign, okay? So we need to define usage. We need to define the Denny sign, for example, and how they can change that sign, for example.
Like for like.
Like for like, So, but I think we're all over the place here with regard to pole signs, and I think, instead of us going for the next hour discussing all this, I think we have staff come back with some suggestions as per our suggestions.
Okay, can I just, real quick? I totally agree. I think we're beating this up. But I think the other thing we better bear in mind is that there's like 13 of these pole signs. I mean, we're making 11. We're making a mountain out of a molehill. I think we can get focused. If we even wanted to say that out of those 11 that we'll do an inspection, These are all very possible things, and you're right, Wayne, the city ought to come back and say, here's a reasonable way to deal with this, and all I feel like, though, is at the bottom line that there's got to be some end to that sign at some point, that they just aren't going to be there forever, but they should be there for a comfort level for these business. And I agree, why don't we move on and put that one aside and approve the other ones?
Okay. Do we have consensus there? Would we get a straw poll of,
What's our direction then to show?
yeah. What do we need for staff? We've got 2/3 of it.
We never really discussed Michael's thing. What if there's a 25-year boom and nothing else? And they're gone in 25 years? What's the thought on that?
Well, I think that's time for staff to go back and look at it because there's legal ramifications to that. And I think, 25 years starts when, ends when,
Starts when the ordinance is enacted
We can do
and...
it. We have it built in, like, that would be similar to option 3. So on page 5 of Exhibit 1, that would be F, so you could change the grace period to, signs subject to sections may not begin until 25 years from, and then we'll fill in that time based on the direction from whenever it's codified. If that was the direction, we can make that happen. So that would be where that would happen. Where we could do it.
That's not not a grace period. It's a sunset clause.
Yeah, that's
the end of 25 years.
That's what that would mean, sir.
My comment on this issue is by adopting the ordinance to prohibit new post signs and freeway-oriented signs, we add more triggers to that pool. So hopefully, because ultimately our goal is the reduction of the signs on the freeway. So by doing that, hopefully the reduction of the freeway signs will be accelerated comparing to the past decade. And there are some signs, they look good, they can be maintained at a very good condition, but eventually things go away, and we don't need to cling to that. So if it's beyond being able to maintain and be safe, then just let it to be taken down.
That's what.
And I'd rather to see things to go away slowly instead of having set a deadline and then suddenly we remove everything.
Okay.
I know that Commissioner Ruland, you're concerned about the safety. The existing municipal code, I think, establishes the standards pretty well and allows us the ability to make the decision, and we've done it in buildings. It's no less of a difficult decision with a building than it would be with a sign. So I feel pretty confident that our maintenance requirements and standards fulfill that role. But there's a bigger question with the commission. If you wanted us to come back with some suggestions from the pole signs, I'm not really clear what you're looking for. I hear Wayne's talk about, well, maybe we ought to think about some kind of compromise solution. I hear, you just want to know how far out the amortization should be. Is 25 years enough? We suggested 10 as a fair compromise with the intent that the goal would be to eventually eliminate these within a reasonable period of time. At 25 years, you're basically almost like no amortization, because in 25 years, there's a good chance that most of them are going to go away just by nutrition.
Here's right now on a
attrition.
As I kind of did a straw poll, as people, as we all debated here, it looks like there was 5 of us that were not in favor of amortization. In other words, come to, and so I think the current ordinance, by attrition, by maintenance, by the ordinances in place for maintenance, and there's cost benefit trade-off on either curve, so to speak. Eventually, the owner's got to come forward with the fact that there's structural issues. We're in a maritime environment. There's rust. There's there's all sorts of things that happen to signs that you can only chip and paint for so long. And so at that time, that's when the trigger point happens. There's been an attrition over 20 years of some 8 or 10 or 11 signs. So I think if somebody wants an endpoint at 20 years, well, we're working on it right now. And so I think we ought to keep it simple. I don't think we ought to have a solution looking for a problem or whatever. So to me, keep the freeway sign issue with no amortization, and then over time, they'll attrite. But sometime, they're out of, if we make the decision we're in the freeway business, they ought to at least be able to make some like for like. No structural change, no this, that, some energy efficient thing from a maintenance standpoint that says, okay, the business guys on this side of this equation are certainly will, like the business tax and a few other things. So there's a compromise here. So I think no amortization and just let the attrition go as is, but somehow give the owner a flexibility to, like for like, make it easier to maintain his sign. Eventually that's the light part. That's the part we read. The structure that supports it up there over time is going to eventually fail. Ships rust out, whatever. So that's my feeling. So I would go with the code is written with no amortization, but somehow can we come up with some alternative flexibility of like for like is the only thing I'd say. That way we keep it simple. A clarification of change of use, like Commissioner Eggleston pointed out, which triggers this thing, and sort of some sort of like for like ability to at least update or modernize the sign.
If someone wants to come in and say, my house has gotten old, I'm going to rebuild it just like it is, and it's non-conforming, they can't do that. They can't do a like for like with a non-conforming house. They have to bring it into conformance. Right. So
above a certain square foot.
That's why people leave one wall up.
Right. So
Not anymore.
But they still have to be more.
So my point is if we allow a like for like, we're essentially saying you can keep replacing your sign for as long as you want.
Well, only I think the visibility part of it, the readability part of it, the structure, the pole itself, if it rusts out.
Well, the technology,
it's a
if
safety
it's neon or if it's internally lit plastic, it's got to stay there. You can't go and, change all the guts of it, so to speak, to a new technology, right?
I don't know. For example, the Jenny sign, this is an example, okay? For the Jenny sign, the pole stays, okay? But the lighting mechanism inside can be changed. The shape of it can still be the same.
Has to be.
Has to be the same, but it could be the new logo, for example. So that would help him, but the pole stays the same because that over a period of time is going to fail.
I think if we don't do amortization, we got it. My interest, my recommended direction to staff would be to have them come back with some clear understandings of how we make that judgment of when it's done, of when it's a non-conforming thing that has to be taken down. Because I think if you're changing everything about the sign except the pole, well, that's kind of, the sign itself is an important part of the sign. Isn't that 50%, or couldn't that be considered it?
The pole's eventually going to fail.
Let's have a straw vote on amortization. Who's in favor of amortization? Raise your hand. Sure. That's you. It's down to one. Who's in favor of no? Well, two now?
No.
Just a minute.
My solution is not amortization.
Okay, fine. Thank you very much. I'm having a straw vote here. Who's having a straw vote? Who is not in favor of amortization? We have one in favor and 6 that are not in favor of amortization. So can we move that aside now? Thank you. Okay. And so we've got that part of the thing fixed. The rest of the stuff we're in agreement on. We've got into a side argument here about like for like. Let's set that aside. Maybe that's another issue to come back with. But pass this ordinance as it stands without amortization.
Don.
Yeah.
Chairman Brown. I have a question of Jim, possibly. Now, how do we treat, regarding structural seismic reinforcement, how do we treat that with structures, commercial buildings? Was there some sort of a requirement that operators bring their buildings up to code and introduce seismic reinforcement if necessary, if their building was built before a certain year? Or is it?
That really relates, but yeah, the city did a survey of structurally, it has to do with structurally unreinforced masonry concrete buildings, and so that was an analysis. Actually, San Clemente doesn't really have those. We're mostly all wood framed. So, and then the Miramar's one that actually has reinforcement.
Okay, the reason I ask is because, and we have some architects on the commission here, we have towers that are, do we have any that are over 50 years old? Quite a few.
I
right?
believe the earliest one in terms of my research, the earliest one was the Denny's, and I believe it was 1962 or 1964. I know it was early to mid-60s.
So it's close. So I don't know what powers we have here, but as a city, can we approach these property owners and request that a seismic report or a structural analysis be done on their towers?
Mm-hmm. Mr. Chairman, Commissioners, we can take a look at that, but I'm guessing, based on past experience with this, that that's going to be governed by state building standards and the building code. And so it's really outside of the purview of the Planning Commission. And we can look at it, but I don't think that we're going to have any ability to do that.
Okay. I don't know how we can vote on this. There's so many unanswered questions at this point. I think we can vote on the 64 and the temporary, but I think for the pole signs, there are unanswered questions.
Well, we're still trying to give Sean direction.
Oh, well, the chairman wants to vote on it.
Well,
I'm not comfortable voting on the pole signs at this point.
Mr. Smith.
I agree that I think we can vote on the temporary signage. We can vote on the square footage signage. We're not there on the pole signs, but I would like to put a straw vote out there for a sunset clause of 25 years, so that at the end of 25 years, there's not going to be any haggling about it being this or that and everything. That is the end of it, and it's very simple to
Let's have a straw vote on 25 years.
I'd like less than that. I'd like less than that, but I have no objection to 25 years.
What's the question again? A maximum of 25 years.
It's
straw vote on a sunset clause of a maximum of 25 years.
From the approval of the ordinance.
Right.
So I say 1, 2, 3, 4, and 4 versus 3.
Okay.
That's Smith, I'm sorry, Eileen for Smith, Crandall, Rulin, and Eggleston are for a 25-year sunset, and Blackwell, Brown, and Wu are not.
The nice part of that is you can say to the city council that there will be an end of pole signs by that day.
Mr. City Attorney, do you have any words? Any words to offer on this type of a discussion?
Mr. Chair, Commissioners, I have no words of wisdom. The 25-year amortization period would simply be a change to
No, not an amortization, just a sunset.
Well,
yeah,
same thing. Section 17.84.040F. If the commission wanted to go forward with that, they could move staff's recommendation with that change.
Okay, that's with option 3, I guess it is then?
Sure.
No, it would be option 3 with the 25-year grace.
Option 3 with 25 years.
Don't we want to have some of these things put up before we vote on this?
Well, we don't have a proposal, a resolution.
Yeah.
Okay, all right. Well,
You want to continue this until let them come back, is that what you're trying to say?
Yes.
Yeah, let's do it.
What I suggest, since what we would do is, I mean, the 25 years is something that we can add as an, seems to be the preferred option. But then you want to know more information about what's a change in use, because before that 25 years, a sign could conceivably come down if the use changed.
Right.
So you want more clarity,
use?
more clarity on use, and I hear that we want to have a little bit more clarity on maintenance standards and when maybe the 50% rule would be triggered on a sign. So those two things we can come back with. I think it wouldn't be that hard to get together, and we could have that at the next meeting.
It means like the 6th or 7th.
We don't have a lot of time because we only have like a couple days left.
Yeah, because the report goes out
Probably the
next
second
week.
meeting in January.
Length and all the temporary signs, location.
the 3-foot. Yeah. The 3
Okay.
foot.
When we voted 6-1, didn't we approve the option 1?
We did.
But
Yes, they are.
Well, 25 years to me is not contradictory. It's not amortization. It's just that at the end of 25 years, it's a sunset.
Technically, it's amortization.
Technically, though, it is.
Well,
What amortization does.
That's what it's
so
all
I
about,
don't
Wayne.
understand
That's
the-
what you guys,
the subtlety
did you
difference.
understand what you raised your hand for?
We're not,
yes, I want a sunset clause.
Come on.
I don't take your good thing and make it bad.
Yeah, okay, let's continue this till, the second meeting in January. We're not going to be able to turn this around over the Christmas holidays. Yeah. Okay,
I make a motion that we continue item 4D, the zoning amendment 15222, sign exception permit and sign ordinance amendments, to the second meeting in January 2016.
I have a motion, and a second. Second by Ruin, all in favor? Aye. Opposed, passes 7-0. With that, we'll go on to item 9, new business.
Thank you.
It's 11.
See you, Peter.
Did,
Hold it.
Eileen, did you get a card for, good.
Okay, under item...
Thanks for your patience.
Under 9,
Most patient person.
we have Mr. Kessel Armbruster, and wishes to speak to us under new business, okay? Please use the microphone.
Well, I was actually proposing, since of the, to reopen the amendment and allow me 3 minutes to talk, and then
You're under new business for 3 minutes to talk. We've already done the amendment and closed it. I'm not reopening
okay,
that
so
amendment.
then, asking the attorney couldn't then go under judicial review for that pass based off of the miscommunication of the timing.
Mr. Chair, Planning Commissioners, the agenda states 6 p.m. The Planning Commission has graciously allowed the individual to speak for his 3 minutes. If after hearing his comments, the commission is desirous to reopen the item, anybody who is in the majority of that vote, which would be anybody, I believe, except for Commissioner Rulin, is free to make a motion to reconsider, at which point that can be seconded and voted on, and the commission may reconsider. As far as review, this still has to go to the City Council for review, possible approval or denial. That will be the point where comments will be made and then possible review made.
Okay, so you have 3 minutes, and after your 3 minutes, we'll consider whether we want to reopen or not.
Okay, all right, thank you so much. All right, when I look at your guys' proposal, your recommendation, attachment 1, page 3, you guys state the following, and this is what you state. After that, I would like to recommend you guys to add certain notes after that. So you guys state, whereas under the Federal Controlled Substance Act, I wrote of 1972, codified as 21 U.S.C. Section 801 ETESQ, the use, possession, and cultivation of marijuana are unlawful and subject to federal prosecution without regard to claimed medical need. And I'd like to add the following. Whereas under federal law within the Controlled Substance Act of 1972 U.S.C. 801D, the United States Attorney General has the power to change and regulate controlled substances. And whereas in 2009, after several states voted to legalize medical marijuana, Attorney General of the United States recommended guidelines for states on how to deal with and regulate state medical marijuana sectors. And whereas on May 30th, 2015, the House of Representatives passed H.R. 2578, prohibiting the use of government funds for preventing states from implementing their own laws on legalizing medical marijuana, ultimately limiting the federal involvement in state medical marijuana programs and development of cannabis reform. And whereas October 28, 2015, President Obama stated that the incarcerating nonviolent drug offenders is unjust and ineffective. And the current elected Attorney General stated in interviews in October that the regulation of medical cannabis is up to responsibilities of the state. On top of that, I would like to add, within your statement, you said that you guys were going to issue misdemeanors for possession of cannabis. That doesn't clearly justify if the person is a medical cannabis holder or not. It's misleading for police officers. You should look at SB 420 where it states we shouldn't be giving any sort of misdemeanors for that. It'd be, I propose, instead of writing misdemeanors, we should, hand them a ticket to go to AA or something like that. On top of that, I would also like to state within that document, you guys also said that medical cannabis businesses are a public nuisance. Without, a lot of, backing. In my professional opinion, I find that a little bit discriminating towards potential cannabis business, progressive people who are trying to open these cannabis businesses that have been prohibited for, 50, 45 years, and people are trying to, start cannabis businesses to help, seriously ill patients. So, in conclusion, I'd hope you guys to consider these 5 issues at hand, and then the few things I also added.
Thank you very much.
Yeah.
Very well spoken.
Yeah. Mr. City.
I'd like to ask our Deputy City Attorney,
That's exactly.
in summary, what he said.
You're asking for my legal opinion
Yes.
of what he said. Yeah, review the tape. What is clear, I'll just comment on maybe 3 things. One, federal law prohibits the possession and use of marijuana. That's clear. The federal government, the AG particularly, has made it clear that that's not going to be prosecuted. State law allows for cities to regulate the cultivation, the distribution, the manufacture, and the sale of medical marijuana. In the absence of such regulations, all of those things can be permissible under state law for medical marijuana. So does the state allow it? Certainly. The state also, very importantly, pursuant to case law and legislative law, allows us to do what we want in terms of regulating medical marijuana. What is before the commission tonight, what was previously voted on and can be reopened, is directly in line with the MMRSA, which is the most recent medical marijuana law, which follows up on SB 420, which the commenter spoke about, which was adopted several years ago. So again, in sum, it's still illegal under federal law. State law allows us to regulate exactly as we choose. Does that answer your question, Commissioner Eggleston?
Right. Sorry, thank you, but you had your turn to talk. All right, now the question before us is, are we, based on the Assistant City Attorney's legal opinion, do we need to reopen this, or are we comfortable with what we've passed? So we need to consider a reopening, or is that correct, Mr.?
The law allows for a motion to reconsider, which would essentially reopen the item for further discussion and a second vote.
Or, okay, a motion to reconsider. So is there a motion to reconsider?
Well, I'd make a motion to reconsider, but I don't know if there's going to be a second.
Let me ask, I'm not quite sure what was requested. Is he just asking to have this?
Stuff into the ordinance.
But it was more just a statement of more laws. It didn't really affect
Mr.
what
Chair,
we
Commissioners,
passed.
my understanding, and I'd have to look at exactly what was requested, is that the request is that further recitals be included in the document, the ordinance being forwarded on to council. Those recitals give more detail regarding the state of the law, and detail that appears to be more favorable towards medical marijuana dispensaries, cultivation,
We have
et cetera.
nothing in writing here. It's a very well-spoken speech. It would have been great to have something in writing presented for study beforehand, so I'm not particularly interested in a motion to...
Well, the motion I would make would be for this, what he has said and written down there to be then presented to City Council. That's what I would make a motion on.
I don't think we can do that.
And he has the
We'll-
ability to submit it to
The
us.
motion here is to reconsider the item
right.
or not.
That's right.
That's what's the motion before us. So that's a different motion. So we there is no...
To be clear, once the motion to reconsider is made and seconded, if it's seconded, if a majority then votes for it, then the item is reopened,
That's
and
correct.
and issues like this could be considered, and a new motion to forward something to the council could be made, which could include the recitals. Again, if the commission wanted to go that way. So this really would consist of two separate motions.
Right, one to reconsider and then one to incorporate.
That's exactly, that's correct.
Of which we have no time to, we've not had the opportunity to evaluate or staff to evaluate this written or this verbal input. I'm very uncomfortable with that.
Could we also simply make a motion to have this gentleman's input included in the package that we're in the recommendation that we're sending, not with a recommendation on our part, but just with, this was a comment from the public that we thought would be useful?
Would it be appropriate to say, to direct staff to include it in their staff report to City Council?
Mr. Chair, Planning Commissioners, that would be appropriate. Again, we'd have to take the first step of
Yeah,
a motion to
we have to
reconsider to reopen the item for Brown Act purposes.
I'd just like
But once
to-
that's done, that could certainly be done.
I'd just like to say that any public comment that we receive will be forwarded on to the city council. So if he just simply just gives it to me
Yeah.
as a public
That's-
comment for city council consideration.
Put it in
it'll
writing
be
and give
forwarded
it to staff. Then it'll be concluded in the package for the city council. Just put it in writing and give it to staff, and then it will be forwarded to the package to the city council, and then show up again and talk.
And that has the same effect of what I said, so.
Yeah, and he could also,
Because we're not going to consider each item that you talked about this evening, because we have not, we don't have a staff presentation on it, so, what he said was just fine.
Okay.
If you just give it to staff, then it would be in the
Okay.
packet to city council.
So we still have to have a motion to reconsider, and then, no.
No.
If the document simply being given to staff to include in the packet going to council, then
Okay.
there's no need.
Put it in writing and give it to staff for inclusion in the package to city council. Okay, thank you. With that, is that motion? We should close new business. It's closed. Old business is none. Reports of commission and staff. It's late. Anything going on there, Coastal Advisory Committee?
yes, I prepared a very lengthy and detailed report.
Let's read.
But I left it at home.
Good job.
So I'm going to have to just revert to memory. Maybe I'll give you the report from Eileen. So we had our last meeting on the 10th, and we had a very interesting presentation by, was it a county representative, Eileen, who sort of walked us through Orange County Board of Health, walked us through how bacteria sampling is conducted throughout City of San Clemente beaches. Very interesting. And still the two high receptors were Poche Beach, Poche Creek, and the pier. Interestingly, they're going to, remember how we talked about the high bacteria levels at the pier? We're wondering where it was coming from. Is it from the birds? Is it from a sewage break? Still don't know, but they're taking it one step further and possibly getting into DNA sampling in the soil there to really see where these...
This is a sudden appearance because we haven't had that issue this year.
Right. Yeah, so we have some assumptions that it is the birds, but the samples that they take and test will reveal the profile of that bacteria in the origins ultimately. We also talked about the upcoming Trafalgar Canyon project, which we had really no information presented, but there was discussion about it as a future item.
What project is that?
Trafalgar Canyon plan? I don't know. We'll find out. Am I getting it right? Is it the Trafalgar? Yeah.
It's a capital improvement program to, like Poche over time, to improve Trafalgar Canyon. They're working on it. Staff's working on the engineering.
Most importantly, for those that are interested in the sand replenishment project at our beaches, there was some uncertainty last time I brought this up to the commission, and we weren't sure what the plan was. Well, it turns out there was a presentation made. It was an around town video prepared that featured Tom Vonnegut and Tim Brown that really walks you through the entire project, where funding's coming from, how beach erosion is occurring, how it will be replenished. Very informative, very interesting, answered all the questions.
Not very well
quite
advertised.
Nice. Not very well advertised, and that was something that one of the committee members brought up as a possible item to place on the one of the committee agendas, to note, public notice, have people come in and listen to it, maybe get the word out by email, whatever. But very, very informative. That pretty much sums it up.
Good.
That's the short. That's the short version. Yes.
I was on that commission, and there was a commitment to what they call the Poche Action Plan, which laid out various steps along the way to ultimately achieve the opportunity to take on the drainage that comes out of the Poche area after it gets filtered through the filtering system, to then pump it back into the sewer waste system that injects it out by Dana Point. Right. And what I'd like to know is, are you tracking that? Are you making progress? And if so, where are you in that process?
Well, since I've been on the committee, there's been really no discussion on that, enacting that plan. Maybe Chair Brown could speak to that more.
We can probably get Tom or Mary Vonder to give you an update. The key long pole right now is the completion of the sewer master plan, which is funded and it should be ongoing. I don't know when it's going to do to complete, but that's the driving force that gives you whether it's economically viable and technically feasible, or i.e. the throughput is there to in fact accomplish that and divert. So they have to do a sewer master plan so that you have the capacity in the pipe, so that you can in fact take whatever comes out of Poche and put it in the pipe. So you're limited by permit to 6 million gallons a day, and so you have to now have enough through other measures like all the expansion of the purple pipe system. Have you decreased the amount we put through that pipe, so that now you could put Poche runoff, which is about 500,000 gallons a day, into the pipe. And that's driven by the sewer master plan, and I'm not sure when this gets completed. It's funded and it's ongoing right now.
So it's a link in the,
that's
moving forward.
That's the key link in the chain right now to going forward.
I went there one time, the sandbar at the end of the outlet was high enough that the underpass was flooded.
It does that all the time.
Does it all the time?
Yep.
Is it intentional to get king of storm water?
Long story, we would be here till sunrise, talk to Mr. Blackstone offline, and we'll give you the full story on the Poche Beach.
I can look into those two items next time we meet. And
I will entertain a motion to adjourn. It's been a long day.
A second.
I will move we adjourn to the study session to be held at 6 p.m. on January 6, 2016 in Council Chambers, City Hall, located at 100 Avenue, Presidio, San Clemente.
I have a motion. Do we have a second? A second by Smith. All in favor? Aye. Passes 7. All opposed? No. Passes 7-0. Merry Christmas, everybody.
Request you, dark sky.